So what challenges do you experience when you are designing your program? If you may write in the chat box. Yeah, assessing the learning needs of the audience and discussing with management, training, and need. Very good. That's, I completely agree with Dr. Shashikala, that we really need to very clearly know what are the training needs of the audience, and also what do management expect from you, because that's another important thing. So what challenges do you experience when it comes to designing a program? Yes, vague requirement, absolutely. I think this is just on the, they will expect some miracle to happen. They'll expect you to, play a magic band and then change their people. Absolutely, yeah. There's a lot of variance, I agree. Then attendance and participation, I think both of the people. Then methodology to use, yes, unless we are very clear about what will work, there can be, challenge in choosing what we'll do. Variances. So Monica, variances in terms of the audience or the topic or what?
Yes, ma'am, in terms of audience, obviously, like sometimes we have doctors in the audience, sometimes we have nurses.
Yes, yeah. Absolutely, absolutely. So accordingly, you really need to customize your program so that it, it goes well with the audience. Cost is another factor, yes, and either when you are organizing or when you are a trainer, both are a factor. And sometimes, I remember initially when I started doing trainings, and when it was from the government sector, when I used to receive a call, they would pay just 500 rupees for an hour session, one and a half hour session, 500 rupees. So you can well imagine that would not even cover your travel cost. Forget about the time, and nobody values the time you need to invest for the presentation. So you invest a lot of time, when you are preparing a program, and I agree that they don't consider all those things. So, okay, reception, have they understood? Yeah, reception and deception, both. Both, absolutely. Mixed audience is another problem. Yeah, a lot of time you'll have this challenge. Somebody will ask you to do a program and they'll say, we want everybody to be given at one go. So maybe 60, 70 of them, and doctors, nurses, paramedical staff. I mean, you don't know what example to pick for which category, and it becomes very, challenging sometimes. Absolutely. So how do you keep them engaged? That's an important this thing. I completely agree. And we'll talk about it in depth. To sustain their interest, quite similar to what Dr. Gaurang has said, and need to work on the people engagement. Yes, absolutely. That's what is we are trying to work on. Number of participants. Yeah, I think Dr. Virendra, same thing what I said, that a lot of time you will plan for something and then you'll see a very huge audience sitting in front of you. You don't know how to engage them. Less experience with adult learning philosophies. Absolutely, I think that's a very important, thing. Probably sometimes we are used to teaching one type category, but when it comes to doing it with the, intelligent, educated professionals, you may fail miserably engaging them. And I agree. And cost is still a big factor. Absolutely, Monica. I think this is one thing. Very, So what we are going to talk about it. What can ensure that your program actually goes down very well right from the beginning till the end? And that's what we need to first of all ponder upon. First point that I want you to think about is, who is your client? Who is your client? It's not just the audience who is sitting. Like many of you said, management also. Like Dr. Shigla said, it's not just the participant who are sitting, but it is also the management. What are their training needs? Because I'm sure they are facing some challenge, and that is what they thought, okay, let's organize this training and that will help them changing people. But then now you have both as your clients, and you need to really understand what are their expectations. And many of you message that sometimes their expectations are very unrealistic. So a lot of time in the beginning when they ask me, we are looking for a change. We are looking for a change. Then I said, sorry, this is just sensitization. In a 2 hours program or a 3-hour program, you cannot change human behavior. Human behavior requires sustained effort over a period of time. Then you can expect, a change. Yeah, Dr. Monica, you wish to say something?
Yeah, ma'am, when I would like to share my personal experience when we started training like 2 years back. So when we started like what all programs we were bringing to Punjab, like from NCR and all down south, what all doctors were learning. So there was like this sense of entitlement कि हम तो डॉक्टर्स हैं, हमारे लिए तो फ्री करवाओ. And then जैसे उनको वहाँ MRs की होती है सब कुछ फ्री करवाने की, MRs organize कर रहे हैं, it would be free for us. So it was very difficult for us to initially, ask them to pay a certain amount, even if it was a mere amount of 1,500 or 2,000. So that thing, what I have I'm still experiencing that here now also.
Yeah. So initially you will be called in number of places in conferences and programs to deliver talks. And usually they'll say, I remember I had I wouldn't be mentioning this specialty, otherwise it will cause conflict of interest. But I was called by one of the very senior, person in the association that, ma'am, we want to organize full day workshop. And for that, we want to even create our videos and we want to talk about, in detail about it. And okay, they asked me for the outline. I shared everything in the beginning, and then I asked them like, what are the terms and condition and like payment involved. Then I gave them a quotation. I said, I will be investing these many hours, so I require this X amount. And he principally agreed. He said, okay. And then after 2-3 days, he said, my president wants to talk to you. I said, okay, let's go ahead. And we organized a Zoom call, and he said, ma'am, we can't pay you, but if you can do this program free of cost for us. So I always say, if you don't value your time, people will not value your time. I hope Dr. Dipti remember this comment of mine, which I made once. If you will say, I'll do it free, people will ask you to do it free. After that, like I told him clearly, I said, I'm sorry, I can't, go like this, because then that's my bread and butter. Will you operate anybody free of cost all your life? Will you treat a patient without charging? So you are being paid through some ways. For me, this is my bread and butter. But I know most of you are not into exclusively training, but that's one of the things that you do. So maybe you can pick your this thing. But I would say, of course, when you're establishing yourself, you need to showcase your work. A lot of time people ask me, can you do one small session for us? I have stopped doing that. Earlier, there was a time when I needed to do, and I did that. So what I'm saying, that the usual expectations are that either do it free or you don't charge me this time, or you will get a lot of clients from us, so give us a demo. All that is very, very different. But I think we are talking about how do you go about designing a program. So I was expecting that when you are designing a program, it's very important to understand what steps will help me to have a proper structure of what we are doing. So let me quickly share these, set of slides that I've prepared for all of you, because that will give us, a flow in the program. Give me 1 second. Okay, there we go. So we have talked about these small things. I'm going further. Yeah. So let's understand how do you go about designing a program step by step. I think first thing is, as many of you wrote, that we need to find out the training needs. A lot of time you will be asked, ma'am, ek soft skill training le lijiye, sir, ek soft skill training le lijiye, but you need to know what exactly is the challenge you are facing and what exactly you want me to address. So whenever now I get an invite, I ask them, what problem are you expecting, or are you facing, or what behavior do you want to modify or me to focus on? So that gives you a lot of idea about what are the training needs of the organization or the audience. If possible, do training need assessment. In corporate sector, that's one part of the training modality, but in healthcare, I think still we are far away from this, because people are not open to having a structured, dedicated way of conducting a training program. They'll just ask you for random programs, so there probably you'll not get a chance to do the training need assessment. Now, based on these training needs and the expectations of the organizing, you have to start developing your program. So very important to know who is your audience. Very, very important. Initially, even I used to, okay, it's hospital staff. No, doctors, nurses, residents, consultants, very clearly you should know. Now I ask for Excel sheet. Please send me the Excel sheet of your audience. So in the Excel sheet, what I ask, like name of the person, position in the system, how many years of experience, their qualification, so that now you know whom you are going to meet. Now if you remember, I sent you a questionnaire before we started the program that gave me an idea how many of your trainers, how many of your clinicians, how many of your management personnel. So now I know what is your training need, and based on that I can actually make sure that I fulfill your requirement. So the steps that I want to share with you is, the first step is that develop training objectives. Clearly have what you want to deliver from the point of view of the management, audience, and from your point of view, what exactly you want to deliver them. If you will have clarity on the training objectives, you'll make sure everything that you aligns with the training objectives. So based on this, you will be developing. Second thing is create your bucket list of points. So those of you who are seasoned trainers or who have a lot of knowledge and expertise in this subject that you're going to conduct a training program, so automatically you'll have a lot of ideas coming from your inside, and just keep noting down. I use this tool called eDraw Mind Master. Has anybody heard of this? Anyone who has heard of eDraw Mind Master? No. Okay. So this is a free tool, and also the paid version is available. I haven't taken paid version. This is a free this thing. Let me show you the the eDraw. Give me 1 second. Let me show you a sample of how I'm using. So what I do in that is I would, my goodness, why is it taking so long? Give me 1 second. Yeah. Okay. So in eDraw Mind Master, what I do, whatever ideas come to my mind, I just put them in as floating topics. You can see it here, floating topics. Whatever points come to your mind. Oh, I can talk about it. I can show them this. I have this video to discuss. This much of time I have. This is whatever thoughts come to your mind. So I would actually create it's more like, whiteboard on your laptop. But the good point is that you don't have to rub it, or it doesn't go away from you. It's right on your laptop. Anytime you can visit it. So I'm using a free version of it. You can download this from Play Store, and you can create your eDraw Mind Master map for every topic that you. So for example, this is the program I did for IP University. So this is what were the topics that I thought I'll talk about them. Then on each topic, you can have in-depth, details about what you want to talk about. You can further go on. Or for the master trainer program that I did, so I would have time left to start, number of registration done, how much, how to reach more people, whatever thoughts come to your mind, that can be part of that eDraw, Mind Master. So this is how I normally, create a bucket list of things. But for those of us who are getting new into training program, or the topic is new, you can do little bit of R&D on Google, and you'll get a lot of material on Google on every and any topic. And then you can consider what will fit into your requirement. But those of you who have thorough subject knowledge, it's only a matter of recollecting those points and making a bucket list of points that you wish to talk with the program. Now create a flow in the content. So when I say create a flow in the content, we all know a program begins with some opening statement or activity or whatever. We'll talk about it. Then there's a body of content that you want to deliver. Then end. How are you going to end it? And then what is the takeaway? So make sure that you have clearly defined what you're going to talk in the beginning, what is going to be the body, what is going to be how you're going to end it, and what is the takeaway. Whatever points you have created, now you can reorganize them in a manner so that you can actually fit into whatever you want in whichever order. So initially, maybe the bucket list will have content in haphazard manner, but then all that has to fit into the flow of the content. After this, it's very important to not focus on the training pedagogy. because it's not just the content. A lot of you will have a lot of content, but what is going to make your program successful is your training pedagogy. So I'm sure you will have a bucket list of pedagogies also. If you don't have it, you can create. What all can I have it? It could be role play, it could be questionnaire, it could be, one second, let me take this up. Yeah, it could be experience sharing. So it could be, storytelling, rapid fire round, puzzle, group activities, videos, and whatnot. Have this list, as a list with you. And what all videos you have, what all role plays can you think of, what all rapid fire round will fit in here, what questionnaires will help you here. So have a kitty of all these things available. And now from this kitty, start integrating these pedagogies or these activities with the flow of your content. So it could be that you want to start with the video, or you want to start with the questionnaire, or you want to start with the puzzle. You can choose. And slowly, once you apply one, you will realize, okay, this worked well for me. So you'll remember, okay, this activity will fit in here very well. But have a plan, very clearly designed plan ready in front of you, where you know where we are going to, integrate where. Don't forget to create your course material. It could be a handout, maybe just 1-page handout, 2-page. If it's a 2 hours program, maybe 1 or 2-page handout is good enough. Like, for example, for all of you, I thought of preparing a, complete handbook, so that whatever topics you want to cover, you can read the content and develop your program. And you have some clarity on what exactly we mean by clinical communication. Step 7 will be, now you prepare your questionnaires for pre-test, post-test, and feedback. Keep it simple, but you must have to know what has been the impact of your program. Don't forget to take feedback, because feedback will give you an idea how do you go about improving your trainings. Therefore, you must have but don't keep it a very complicated kind of a feedback, and encourage your audience to go about giving honest feedback, so that you get an honest feedback from them. Now, execute your training. So when it comes to executing your training, okay, I'll be talking about it further. Execute training, then take feedback from the participant. And as I said, feedback is very important, and that feedback will really help you improve your trainings. Evaluate your trainings. I think nobody can be a better critic than you yourself of your programs. If you sit with yourself and ask, what I did well, where did I go slightly, low in energy, or low on content, or low on engagement, those are the areas that you need to, work on. So I attended one program recently, and it said, learn to be comfortable in being uncomfortable. And the message that I got from it, sometimes you will not get a good feedback for your program, or you may yourself not feel comfortable about how you did that program. But if you're able to tolerate that ambiguity, that, pain, trust me, you will come out much more evolved, because you will work on it and you will improve on your, weakness. Then, of course, time your sessions, very important. If you don't time your sessions, you're likely to, go haywire, except in very exceptional cases where you think it's all right to go even beyond time. Try to stick to the timeline. That's very important. I mean, I used to initially have this challenge, when people used to ask me to come and speak in the conferences for 8 minutes, 12 minutes, 15 minutes, I would say impossible. I can't talk about, a topic in just 5 minutes or 10 minutes. But then I worked on myself. I said, if the conferences ask for this kind of a, delivery, then you have to learn to deliver in that manner. Then I worked on myself. I started recording my, I started writing the script also, so that I know when, and I would record it. And if, for example, I have to speak for 12 minutes, and if the script is for 15 minutes, then I'll make sure what I can cut down. And this really, really helped me. I remember I went for a program, and we were 5 panelists, and each one of us was given 10 minutes. And last 10 minutes were kept for discussion and question answer session. So I think I was number 2 or 3 in the delivery. And because I had worked on my timing of the session to make sure that you are able to deliver in exactly the time that you're given, I delivered it in less than 10 minutes, I think 9 minutes and some 30 seconds. a lot of panelists could not even complete the introduction of their topic in 10 minutes. And because in conferences, usually they will take away your video, or I mean, take away your presentation. If you're going beyond a time, they will always have a clock running, backward. And the moment your time is over, the video or your presentation will be stopped automatically. And a lot of the panelists had this challenge. They could not introduce their topic. So it's very important to time your session, especially when you are, designing your program. In a 30-minute session, don't have more than 30 slides. That means at least 1 minute per slide you will get. But a lot of slides can be just skipped in maybe 30 seconds, maybe even 10 seconds, because if it is just one small thing to say, you need not talk a lot about it, but make sure that you are able to cover everything in the given time. So when you are designing, these are the things that you need to consider. As I said, who is your audience? With the same topic, you cannot cover all audiences in the same manner. Like I'm answering Dr. Ila's question here. If I have to talk about empathy, I did a program for consultants, and I knew they were very, very picky and very, kind of looking for an opportunity to find fault with you. So I needed to introduce the topic of empathy with them. I first made them do a role play on how do we really treat our, subordinates and patients and their family members. And I just give them a free hand to do it. And then I made them close their eyes and made them use creative visualization. I don't think any one of you have taken creative visualization as a pedagogy as yet from the list. Does it have that list? I mean, does it have that topic in the list or no? I'm not sure.
I think it's not there, madam.
Oh, it's not there.
I think it's not there.
Because in the last group I had, maybe I have removed, I keep adding new pedagogies.
I may be wrong. I chose the topic in a very last moment. So I had one glance. I remember that it's not there.
Okay. So I made them, close their eyes, and I took them to one of the patients in the ICU. And then I said, okay, imagine if this patient was your family member. And now for a few minutes, forget that you are a consultant here. Enter the hospital like an ordinary person and not a doctor. And then I took them to various areas of, hospital, pharmacy, lab, radiology, front desk, billing. And now I asked them to visualize, if you were not a doctor and if you did not know anybody here, how do you think these people would have treated you? And would you have liked the way they treated you? And many of them were actually in tears. So if you are able to use some creative pedagogy that can help you to click with them. And I'll also talk about how do you really align them first, because you first need to align them with you. Only then their inhibition to participate will go down, and then their honest self will come out. So it's immediately going and talking that, okay, you lack empathy, doctors are insensitive, they work mechanically. I'm accusing them. I think it will be very wrong on my part to accuse anybody on these grounds. It's not their fault. They haven't learned it. They haven't been trained to use empathy and sensitivity. Rather, from their role models and from their seniors, they have learned empathy means attachment. Empathy means taking the burden. Empathy means you are, caring, worrying about the person. So that's not required. How can you worry about 100 patients? So automatically you stop using empathy in your practice. So that's how you will have to really, first of all, know your audience and then design your program, keeping in mind the audience that you are going to address. In a lot of time, you will also have this, challenge that you are told that they are doctors. And when you enter, they are not doctors, they are nurses. I was invited by one of the hospital. They said, ma'am, पर्सनल ग्रूमिंग के ऊपर इनके लिए सेशन लेना है, प्रोफेशनल एटिकेट्स के ऊपर सेशन लेना है, and they are all nurses. I said, okay, but it was a 2-day session. I said, let me go and meet the audience once, because that gives me, some comfort and familiarity and makes my job easy. So when I went to meet them, they were around 60-70 of them. They were called in one room, and I just asked them, okay, tell me about yourself, who are you? So one by one, each one of them said, I'm so and so, and I'm OT technician. I'm so and so, and I'm OT technician. Then I started asking, where are you posted? Somebody said ICU, somebody said ward, somebody said emergency. I said, OT technician in the ICU, in the ward. I mean, I'm not getting it. So I said, like, you need to explain me. Normally, we would have OT technicians in the OT, but why in these areas? So then I got to know that what they would do. That was a hospital very close to rural, area. So they would pick students from various places, and they will ask them to enroll for this program called OT technician. But they will use this staff as nurses. They'll be wearing the uniform of nurses and would act like nurses, but they're actually OT technician. So a lot of time your audience will be very different. I'm sorry, from where are we? Okay. It's very important to confirm who is your audience so that you can, create your. Then audience size, again, it's very important. I would say be very clear about the audience size. Do not recommend more than 20 to 25 people in a group, because it's a hands-on training. You'll be making them do role plays, questionnaire, discussion, group activities. If you have large audience, then it's going to be a challenge. Even on Zoom, I would normally say not more than 24 participants, because on a screen you can see only 25 people at a time. But I have had requests from recently I did a program per center per site. There are 60, 70 people. They said, ma'am, we have to have one training in one go, and everybody will join across the country. So all their even, business heads and everybody was there. And I said, okay, I mean, you can just advise them, but they may not agree to you. But it's better to, help them see why having a small audience size is more helpful. But a lot of time it will happen that you will go with an idea that there will be a lot of people. But I recently did a program for Delhi Judiciary Academy. I do a program for newly inducted judiciary officers. There were just 5 of them, and I had prepared this session for a larger audience, because normally there will be 60, 70 of them. I didn't check, and I got to see there were just 5 of them, and they were quite senior people who were actually, retired public prosecutors and from the judiciary. They were being inducted into another program. So you really, need to check and confirm so that you are better prepared for it. So how willing is the audience? If anybody can, I mean, write in the chat box. I think then we can have more answers. So when you are conducting your programs, how willing is your, audience? Are they usually very happy to be there? Initially not, absolutely. Yeah, initially they are not, absolutely. How about others? Usually not. Very true. Usually not. Most of the times management has directed them. Absolutely, I completely agree with you, Dr. Shashikala, because they would not even know the purpose of why they are here. Sometimes when you ask them, what do you think we are going to talk about? Either they will not have any idea, or they'll give you a very, vague this thing, topic that we are going to talk. Okay, they would come as if they're compelled and they're compulsion. Yes, absolutely, I agree. Mostly due to management requirements, they are there. I completely agree. So it's very important to understand if the audience has not come willingly. I think your first task will be to create interest. Please do not miss this opportunity, because if you are not able to create interest in your audience, you will not be able to align them with you. So the first 5 minutes, 10 minutes, if you want, you can spend on aligning them with you and helping them see that how important it is to be interested. We'll be talking about it. I'll be talking about it in a while. Again, mode of training initially it was only on site. As far as like I remember, up to 2019 I never did any program online. But I think 2019 onwards, all of us now are used to online programs, and people are also becoming comfortable. Audience are also becoming comfortable. But it's very important to know what kind of mode of training that then how much the time is available or allotted time by them, and how much time can you really engage them. Plus, very important is resources available. It's always good to check with them. For example, simple things like, if you're going an on-site program, do they have whiteboard? Do they have enough, sitting area? What kind of sitting area they have? Usually in a lot of places, they'll just have an auditorium and they ask you to do the workshop. It's practically so difficult to do a hands-on workshop when people are sitting like in a lecture room or an auditorium. So it's always good to initially talk to them and let them know what you will require to do the program. Now, some of the things that will really help you in designing the program successfully, very important is when you are designing a program, as I said, to create interest in them, if you can integrate what is in it for me. I think you can note this down. Very important is if you are able to showcase them, how is this program going to help them? You will have their interest. So whenever I do any quality implementation program, say for example, for housekeeping staff. So when you ask them to use, gloves and shoes, most of them, even when I go for assessment, I'm sure those of you who are into assessment, when we go for assessment, we see they'll be wearing fresh gloves and fresh, shoes. That clearly shows that it's not the one which they have been regularly using. It's just to show us that, yes, we are using heavy duty gloves and the, safety shoes, that we are using them. So whenever I talk to them, I let them know why you need to use this, not for me, not for management, for your own safety. Similarly, in the training programs, if you are able to, help them see how is this training program going to help you. So maybe if you let them know that 2/3 of the litigation cases are because of the communication failure. And if you don't want any litigation or violence against you, you need to upgrade your communication skills. It's not just for the patient, but for your own safety, you need to have this. So I'm sure they'll be able to see the purpose, in the program. Second thing that I would recommend is beginning and end should be very engaging. Because if, like we normally say, well begun is half done. So if you're able to, get their attention, get their engagement right in the beginning, your task becomes easy. And if you're struggling throughout the program in engaging them, in helping them see what you want to, talk about, again, it will be a big struggle. And there has to be a very clear carry home message when you share with them. Then ask thought-provoking questions rather than giving information. Never start with giving information. Nobody likes to listen. Everybody thinks I know it all and I don't need to learn. So always ask thought-provoking questions rather than giving information. That will also help them, engaging them. So a lot of time, like for example, for a lot of, in lot of programs, what I do, I said, okay, what is the objective of the program? What do you think you are here to learn? What do you think we are going to talk about? So a lot of time they'll say soft skills or something very, not very clearly. Then I would say, okay, how many of you like window shopping? Some of the participants will definitely raise their hand and they'll say, okay, we like, okay, I'll call one of them. And I'll say, okay, these are the people sitting in front of you. Consider that we are in a mall and they are the shops. And we enter each shop and, interact with the shopkeeper. But because we are on window shopping, we are not going to buy anything. We are just going to ask the price and have some conversation and then get out. So that person and me would go from shop to shop in case if it is an on-site program or if it is an online program, even then we hold in the same manner. So we'll ask for the pen or book or phone or anything that is visible and that we consider that this shop must be selling. But we don't buy anything. We just check the price and we have a discussion and we come back. And then I say this participant, now imagine if you had a bag with you and your phone, and maybe while you were talking to the shopkeeper, you left your phone and your bag there, and you now realize, okay, my bag and my phone is left somewhere. Now, once you have lost something, and if you go asking for it, what do you think will be your approach or a way of interacting with the shopkeeper? So usually, if you have lost something, you will be very eager to find out. And you'll go to each shop asking, sir, I had a bag and a phone in my hand when I was looking, for this book, or I left it here. Could you please see if it's there in your shop, or has somebody taken it, or is it there with you? Have you kept it safely? So I would then ask the audience, okay, what was the difference in the initial interaction and this interaction? And I'm sure you will be able to see in the first interaction, we are more casual because we are not going to buy anything. We're just trying to, kill time or pass time. But in the second interaction, we are eager to get something. I said, if you come for a program without any purpose, it's like window shopping. Never go window shopping for a program. Go with an objective. Go clearly knowing what I want to learn from this. Otherwise, your trainer will come and fool you and go back, because trainer would have a lot of content to deliver. Whatever he or she would want, would deliver. But if you really want to learn, you need to know what I'm looking for. So when you make them do these kind of activities right in the beginning, they get to realize that, okay, I came without any purpose. So I can't claim myself to be very intelligent and very smart. So I really need to know what is the purpose of. So content has very limited value. Focus on creating experiences, because experience has long lasting impact. So this particular activity, for example, or any activities that you will do, will stay with that person. Like for empathy, when you do that creative visualization, that activity will stay with them. When you make them do role plays, that will stay with them forever. When you show them a video which is very intense and very meaningful, that will stay forever with them. So focus on creating experiences. Like for example, content I've already given you. Already you have the content, but then I think this interaction that we are having on this platform is very, very important. So be very creative with your training, curriculum, and pedagogy. Trust me, even if I have done 100 programs on the same topic, I would never use the same content and same style of delivery for the next session. I would always sit and work on my presentation once again. I'll work on the pedagogies. I'll try to integrate more, different activities, questionnaires, puzzles, to make it more interesting and more engaging. So you will have to really, update yourself regularly and be very creative in your training curriculum and your, pedagogies. And when you are talking about anything in terms of behavior or impact, please remember you're speaking to intelligent, educated, professional audience. You really need to, provide evidence to what you say. Now, if you say 2/3 of the, litigation cases are because of the poor communication or communication gap, so it will come more like the statement coming from you. People might start arguing with you. But if you are able to support what you're saying with a study, with some evidence, they are more likely to agree with you and accept you. So always be ready with the studies and updated knowledge to support your opinion and statement. And keep updating your subject knowledge and your skills. Never assume that, I can do it. Like, for example, in my case, as I said, I had a couple of experiences where the audience literally hijacked the session for a few minutes, and I was very, very disturbed. That got me to know, okay, I can have disruptive audience as the way, and I really need to learn how to deal with them. So I didn't just remorse on it. I worked on myself and then I did it. I remember in another program, one of a very senior consultant in a government hospital, right in the beginning, when I put the first slide and I was still settling my things in the, on the dais, and people were still, sitting. One of a very senior consultant, he said, the caption of the program was importance of communication in healthcare industry. So the comment he made was, how can you call healthcare as an industry? Healthcare is not an industry. Had it been my previous self, I would have argued tooth and nail to prove that healthcare is also an industry. But then you have to learn to pick your battles carefully. I said, you think industry is not the right word? He said, no. I said, thank you so much. I'll definitely consider your point. I learned how to handle people who would just, are there to derail your program. So work on your knowledge as well as on skills of handling people. Then I'm repeatedly saying regularly time your session and reflect on it. For the last whole 1 week, I've been thinking, did I do it right? Did I do it right? Was it right what we did? Because this is something that does not happen, with me. So you really need to be sure whether you did it thoughtfully or it was just a mindless action. Then be realistic with how much you can cover and how much you can deliver. A lot of us will prepare a lot of program. I remember in the pedagogy presentation, one of the presenter in the last batch, he prepared 37 slides to showcase a pedagogy. And out of that, 27 slides were not about the pedagogy, but it was about topic that he was introducing. So you really need to be very realistic in how much you can cover and how much you can deliver in the limited time that you have. Regularly reflect on your performance if you want to keep upgrading your skills and your performance. Read the feedback carefully. I do not close the feedback link till I have read everybody's feedback, because that helps me know what I need to add more or what I need to focus on, and take that feedback very, very seriously, and check with your audience if you want to be very sure of it. I think the mantra of success is practice, practice, practice. Don't hesitate delivering initially, even for your own staff or for anybody, before you actually get into real work of training. So let your work speak for you, because if you are doing your job well, people will automatically recognize your efforts and will see you as an expert in your subject. Some of the questions that I want all of you to ponder before you complete your master trainer program, because those of you who are looking forward for a training opportunities or training as their full-time profession, you really need to know what kind of programs you can offer in healthcare communication. There can be any kind of program, for right from support staff to the consultant. So you really need to know how you're going to design your programs. That's something that you need to start working from right now. Then you can also think of list of topics that you can offer. It is not just about soft skills. It could be about professional etiquettes, professional grooming, handling aggressive patient party, handling uncooperative patients, breaking bad news. There may be many more that your client may ask for it. Then to gain confidence, where to start? As I said, initially you could start preferably from a group which is less likely to be aggressive in this section. So I would suggest start with the front desk staff or with the nursing staff, because they are less likely to be, questioning or disturbing you. But then slowly you can go on up to any level. I was invited by Delhi Health Secretariat to do a program for medical superintendents of all 35 hospitals of Delhi. So around 50-60 of them attended a 3-hour session where I talked about the relevance of the program. Trust me, during the program, they made all effort to, ask questions and say things that could disturb me. But the benefit was, when I went to their hospitals to do the program, their way of interaction with me had completely changed, because sometimes we don't accept overtly, but internally we do realize the importance. But then a lot of hard work goes in gaining that confidence. Now, how do you go about pitching your program? You have to start working on it. Those of you who want to, become trainers, full-time trainers, how much should you be charging? That's another interesting question to think of. Maybe initially, as some of you said, that we would charge nominal because you want to get the knack of doing it. But then I'm sure a time would come, you can charge anything that you think you are worth. Then how do you go about marketing yourself? A lot of people use various platforms to give their ad, or use social media to their advantage. I would say There's an interesting program by Vaibhav Cicinity. I don't know if you have heard of him. Has anybody heard of Vaibhav Cicinity? Anybody? No. Okay. So Vaibhav Cicinity is a very young guy. I think must be less than 25.
Digital marketing guy, right? No, like
Yeah,
he makes a lot of
LinkedIn. How do you use LinkedIn to your advantage? Do you want me to write his name in the chat box? I'll tell you what it is. Vaibhav Cicinity. So he offers a program, I think very nominal charges, just 500 rupees or something. He would send you a couple of videos, recorded videos for the how do you go about using LinkedIn to your advantage. And then he would also hold 2 or 3 live sessions. And in each session, there are around 1,000 people attending his program. And it's a very useful program. I have attended it personally. Full 1 week I devoted to it. I learned a lot from it. I'm using some of the techniques that he shared. They're really working. One of the posts that I posted about the master trainer program, the initial post that I posted, it has around 66,000 views, almost like 1,200 comments and 500 likes. I'll share that post with you in the group. Because of that, I got so many people, connected with me, and looking for collaboration and association. So don't forget to market yourself. So business without advertisement is something like winking at a girl in dark, which she does not know. So you really need to market yourself. You will have to market yourself. And there are a lot of benefits. I was invited by Cleveland Clinic, Ohio, to attend their annual summit on the basis of my work that I posted on LinkedIn. So if you're attending this program, don't hesitate posting that I'm doing this program. After you complete this program, don't hesitate posting your certificate, because that will be more like an announcement that, okay, I have done my master trainer program. I have the knowledge about it. I can deliver programs for you. That's how I would say that you must market yourself. And I got a lot of opportunities because of my posts on the LinkedIn. And I would encourage everyone to go about marketing. Then how do you go about writing a proposal? This is something you really need to learn and work, because a lot of time they will ask you to send a proposal and then you can't say, I don't know how to write a proposal. So it's very important to learn how do you go about writing a training proposal, and then training report also. Especially when you will get a long-term assignment, they will ask you to write training report at the end of the program. So you better learn this. This is not in the scope of the program, so I'm not touching on it, but I'm just giving you the structure that these are the areas you really need to work on. Okay, one more thing that I want to say here is, like, for example, when we started discussing, if I talk about the last session we talked about developing communication competencies, but we went around a lot of other topics. So you don't only have to be specialist of the topic that you're delivering, but you really need to know a lot. Only then your audience will be satisfied with you. I remember in one of the program in Cleveland Clinic, Ohio, Pittsburgh, where I went to do this program on relationship-centered communication. So there was a panelist who was speaking, and I was in the audience. I was not the speaker. So somebody from Asian country, they said, doctor, we have just 5-7 minutes per patient to talk, and you are asking us to talk all this with the patient. How is it possible to cover everything in that 5 to 7 minutes? We have 200 patients or 150 patients per day to see. So how do you expect us to really interact with each patient? Even that doctor sitting on the dais was clueless. How do I answer this? Then I just rose my hand. I just said, I'm just giving an idea. Maybe it works for you. And then I said, we really need to train ourselves that what is most important has to be given. So you will have to really, be very clear about, if I want to talk about the drug or drug reaction or follow-up or the immediate intervention or emergency care, whatever. that I need to say, you will have to actually have those points written in front of you that I have to cover this. And second thing is, a lot of time communication is not what you say, it is how you say. So for building rapport, for winning your patient's confidence, to making your patient comfortable, you don't require any verbal listening, but that has to be non-verbal and from your body language. Even that can be used a way to connect with your patient. So what I'm saying, like for example, last time we talked about self-care. Self-care was not part of the topic that we needed to discuss. But then somebody said, we are burnt out. I would say if I'm burnt out because I did not look after myself, not because of the workload. Because my definition of stress is factors leading to stress divided by your coping ability. You can't do anything about the external factors, but you can improve your coping ability. So if you're going on a highway and you are very sure another 300 kilometers or 500 kilometers, I'm not going to get a petrol bank on the way, I'll have to carry a can of fuel with me. I can't say that I'm not carrying fuel with me, so I'm left with no petrol. So that's how you need to really have a lot of knowledge of other topics: leadership, motivation, team building, choosing right people, creating changes, bringing changes, behavior modification. So all that can help you make your program successful, and more you know, better it will. Like for example, creative visualization, we use in NLP, but I brought it here to integrate for my empathy program because I knew that's a way to nail them. So this is briefly about designing program. Anything you think we have missed? If you wish to add, you can write in the chat box. We have a minute or so before we move on to the second topic. Especially those who are into training, if you have anything to add, you have learned training, you're formally trained to be trainers. So anything if I missed, you can add in the chat box. Any questions about it? Any questions?
There is whenever the audiences asks that can you share the entire PPT? Okay.
Yeah.
And in the very beginning, and sometimes you feel like how do we handle that? Because I think that's not a right question, first of all.
Mm-hmm.
Second, it's like they would like to only face you and then later maybe go and read instead of listening to the program, because they can't focus on the program. So sometimes, especially when you are in the midway of it and somebody asks you, this is something important, because wherever I have joined, the audiences are asking this only half of the time. So as a trainer, how do we cope with this? Because
it's your choice. One is, some people I see, they don't mind sharing their PPT. They're very open to it. They'll say, I'm okay. So they'll send it to the organizer, and organizers will share it. It's completely up to you. So my understanding is, I would ask them, anybody who asks me for my PPT, I'll say, you want to be Hindu or you want to be you?
Yeah.
If you want to be Hindu, neither you will be Hindu and nor you will be you. But if you want to be you, then note down the key points and develop your presentation. Because when you write your presentation, if you see my presentation, I've just written one word or one sentence. And that does not carry any meaning because the content is here.
Yes, Dr. Indu, really, I have observed that. So I wanted, that was my second point. So the presentations really don't need to be very heavy on content, right? Yeah, because once, I was in a program and it was an Indian School of Business professor, and he used to have only one line or a two line on the screen, and with some nice images or something, or sometimes only the images, and he was thinking, what can you make out of it? So the technique was even involved. He used this technique of training for a regular program.
Absolutely.
Even if teaching is, done more in the form of a training, it will be more interesting, I guess.
Absolutely.
So I have thought-provoking questions or points that helps more than having a big paragraph on the
Absolutely.
screen.
Absolutely. Absolutely. I completely
Then they
agree.
know what is this trainer going to talk about? There is just a line there.
Yeah, exactly. So that's what I'm saying. That slowly, once you become seasoned in your work, you don't require, and plus if you have a lot of content on the PPT, see, mind can process only one thing at a time. Either it can read or it can listen and understand. If you have a lot of content on the presentation or on the slide, then the person will be confused whether I read it or I listen. And you will see, even if you do it yourself, if there's a lot of content, you will be reading and then you will not be able to recollect what the facilitator was speaking.
Right,
Or when you
right.
are too engaged in listening to the person, then probably you will not be able to read. Personally, I feel you should not have a lot of content on the presentation, because that is just for you to stay on track and also kind of
Absolutely.
organize your flow. That's all. But the rest of the talking and interaction should be done by you, and you have to be thorough with your content. And I'll be talking about it, how much of preparation you need to do in the next session, because ultimately it's the facilitation skill that would decide how successful your program will be. Content you can get on YouTube and on Google search and SlideShare. You'll get a lot of well-made slides on the SlideShare. You can use the same slides. But if you know how to deliver it in the right manner, even a small topic can be, elaborated to any level.
Thank you very much.
These are very important, small things. Those who are into training, they would know it, that makes their program successful. Yeah, two of you have raised your hand. So Pooja, I think you were the first one to raise your hand. So please go ahead. Yeah.
Yeah, ma'am, adding to that, no, the slide wala part, that's been a personal experience also. When we are training, some standards or something, and if we have put up something big on the slide or content, no, although it is important, but the thing is that if we put so much on the slides, no, people see it first. What we say is what they hear, but the thing is that they see first. So if something familiar, no, they find out over there, no, they keep on start reading that, and the entire focus from our discussion goes on to what is written over there.
Absolutely.
So it's like it's something for us itself over there. So keep it short over there, and in a creative manner we can deliver it. So that was adding to that. The reason why I raised my hand was related to the creation of this training proposal, because just not in depth, but at least the major contents which needs to be there, as in what and all needs to be covered in a proper structured manner. Just a bullet points insight on that.
So I think I need to read and then get back to you. But what I do normally, normally people don't ask me for a proposal, honestly. They would just send me an email. Okay, we are looking for a program like this. If you can tell us what topics you can do for us. I would ask some questions in my next email, that you need to give me the details of for which group of people you want, or what are your training needs, and what is the group size. And then based on that, then I'll send them the topics. And normally they would ask you like the honorarium that I would be charging. But then of course, some hospitals may ask you come with the proposal. Honestly, I have not done even once, very honestly. And I've never gone asking for work. I would sit and rather read and do something than going asking for work. But then of course, there is a way to do it where you actually write your proposal, where you want to talk about what is the need of the program. Why is this program needed? How is this program going to resolve your problems? What are the common problems you all are facing in your areas of work? And then how do you intend doing it? After that, probably you'll have to say that this is going to be the methodology. This is going to be the time duration that you require. Now, for example, AIMS Jammu, they were in touch with me for quite some time. I have done AIMS daily program. So they said we want program for faculty, for MBBS students, and for their office staff. I said, okay, send me the topics that you want me to cover. In a 6 hours program for each category, they have given me 10 topics. I said, it's practically impossible. I can cover only 4 to 5 topics in a 6-hour session, because each topic will take 1.5 to 2 hours, because you don't need to, you can't go touch and go. So you need to do activities, questionnaire, self-assessment questionnaire. So it can't be done. So But then, of course, if they ask you for it, most important is what are the challenges they are facing. If you are able to again connect that with what solutions you can provide, then you can give evidence of what trainings you have done. Even that will help you. You can even make your corporate presentation where you talk about the programs that you offer and whatever program suits them. Even that can be, picked up by them. And then, of course, the time that you require and the duration of the program and the charges that you need. That can be at least the
structure, right?
Yeah.
Thank you.
Thank you. Yeah, Dr. Monica, you wanted to say something. Go ahead, please.
Yeah, ma'am, I have a question actually. So my question is about the feedback, ma'am. Like you said.
Thoda sa volume ऊंचा करो, Monica.
Am I audible, ma'am, now?
Yes, it is better. It's much better now. Yeah.
So my question is about the feedback, ma'am. Like mostly we ask for feedback once the program is over. So amongst the trainees, there are few people who are not very comfortable writing. And there are people who are not comfortable speaking also. So is there any alternate way to seek feedback? Because that is like the most important thing to what I feel to design a program. Because
So,
like we'll be having doctors or like
one
different
is,
categories of.
if you have anonymous feedback option, that will make them comfortable giving their honest feedback where they are not identified, because people fear that if I share my name, then I can be, I can be in some trouble, or maybe I'll be at least identified. Okay, this person has given me negative feedback, because we normally have a disconnect with the person who gives negative feedback. So if you think that is one of the here, why I ask for your name and your details, because I need to know what are your training needs and how I need to modify my training to meet your need. That's the reason why I ask for you. And here we expect that you have come voluntarily to attend it. So I'm sure you want value for your time. So you will give me a very honest feedback. I will make sure that I fulfill that now in the future program. So, but in case if that's the problem, then you can ask for anonymous feedback. That's fine. But keep the feedback as simple as possible and as specific as possible. And give them the option.
Sometimes what happens is it is the language, like certain forms they are we make them in English or maybe in Hindi. So कुछ language का भी issue रहता है कि वो जैसे nurses होती हैं या doctors होते हैं या paramedics होते हैं, तो different category का हमारा audience
have both the Google Forms ready. दोनों ready कर. अब तो मैं I have stopped using physical feedback form now. Physical pre-test, physical post-test, physical nothing. No, I am just saving on paper. I just share the Google link with the person who is the organizer. They normally have a WhatsApp group. They'll post it in that group and everybody would answer. Second way, if you want to be sure whether they've really understood it, ask them to give 1 point as a takeaway. So ask each one of you, please give me one takeaway, and it should not be repetition. It should be something different from others are saying. So usually you don't have to go for 100%, because if there are 70 people, you can't have 70 feedback. So if you get 8 to 10 feedback or takeaways, you get an idea. And when you say, okay, if anybody wants to say something, comment, feedback, even that encourages them to speak. Okay, I liked it, I didn't like it, or whatever they want. Even that can be. I hope that answers your question. Yeah. Dr. Benita, you wish to say something?
Yes, ma'am. Thanks for the second chance.
Yeah.
Is it important for a trainer to introduce himself or herself first, or the subject of the training first? Because see, both is important.
Very good question.
But yeah, so how should one do?
So initially, when I started doing, I would first spend 2-3 minutes to tell who I am. But then I thought it was, too much for me to always speak about that. I have prepared this slide for myself. So usually before the topic, I'll put this slide up so that they know who the trainer is. Okay. It also adds to your credibility, because whatever you are doing, if you are thorough with your work and you have, done your share of this thing, that gets showcased in your introduction. I got to see this when I did a program for Army Hospital, R&R. So I'm forgetting the name. I think it was Dr. Pawan Kapoor. He was to take a session with me. So he started with his slide and then he talked about the topic. I found this very useful. I said that's a good way. So I developed my slide like this, and I would usually have this slide as the first slide. much before and this helps to settle your audience also.
Dr. Indu, thank you very much. The second question I have, I think the fourth question rather, is how much of humor is required?
We're going to talk about it in the next session.
Okay, fine, thank you.
We're going to talk about it. Yeah. We're going to talk about it. Okay. So going ahead with the second topic. I hope there are no more questions. No. So the second topic that I want to cover about the training programs is facilitation skills. I know that's one area we normally do not pay much attention. I do not know how many of you have formally gone into learning the facilitation skills, except probably some of you like Pooja and Namrata and who else have taken any formal training in facilitation skills? And why do we call it facilitation skills? Write in the chat box who all have done a formal training in facilitation skills. I think I know Pooja and Namrata. Monica, have you also done any training?
No, ma'am.
No problem. It's okay. I know, because most of us do not know that there has to be a special training in facilitation. We normally think if I can speak well and if I can deliver, and most of us are actually good at facilitation. Any idea why do we call it facilitation skills? Why don't we call it training skills or teaching skills?
I
Probably because
yeah,
Okay.
please go ahead.
It's actually more than delivering of the talk. It's more about the organizing this entire setup. So it's more on an organizational perspective, like organizing perspective, rather than delivering the talk. As a trainer, it's like we come with a topic and we deliver the topic. And when it comes to facilitation, it's about the overall, seeing that even the trainers sometimes are not the facilitators over there. We have a separate facilitator also for the entire program. So that was kind of understanding that I have.
Okay, thank you for
my
responding.
my point was that generally facilitation skills are very subjective. For example, I can quote one. Dr. Birendra just asked about humor. Humor is a big facilitation skill when it comes to audience, but I feel my sense of humor is pretty bad. So here there's an element of little subjectivity. So I think it requires a facilitation skill, they call it separately, because you need to identify what are facilitators in you and then train them accordingly and then help that to facilitate in the delivery of your program. So there's a lot of subjectivity involved in it. So it is separated is what I feel.
Okay, I understand your point of view. Thank you. Yes, Dr. Birendra, please go ahead. Yeah.
I think the facilitation skills are skills.
Mm-hmm.
And if these are skills, this is going to help the trainer achieve the delivery or the purpose. So definitely it is actually skills going to help the trainer to train or deliver. So these are the tools.
Wonderful.
I think these are personality tools.
Thank you.
And set of skills. Rather than this is not the PPT, this is not the content over the PPT or the anything else. And this definitely does not mean human beings also. It is your own self. It could be my body language. It could be my eye contact. It can also be how to make a point by talking the least, or say help them discover. So facilitation is like you're helping somebody to discover.
Thank you. I think you have gone quite in depth. Yeah. So, Dr.
Yeah. Around the somewhere.
Yeah. Thank you. Who else was answering? Dr. Dipti, what is your understanding?
Ma'am, is it something about like bringing up?
Actually, I was going to ask on this only. I'm not very clear. What do I understand by facilitating? Because we are not into this. I mean, this domain is totally new to me, and I don't think I'm understanding what I'm listening.
I know.
So I think you must be reading my expressions. Also, and I was wondering what you all are mind readers, and so it was.
But I hope whatever we have discussed prior to this, you were engaged and you were listening.
No, I've taken all the notes, whatever about the organization program on my mobile, on my thing. But the thing is, this facilitating, ये एक अंग्रेजी का शब्द है जिसके मायने मुझे समझ नहीं आ रहे in my context.
अभी बहुत इंटरेस्टिंग और बहुत अच्छे वे में समझाऊंगी आपको और आपको मजा आएगा सुनने में. And you will agree also. I promise that you will agree. Yeah. So Dr. Monica has written something. Sorry, आपको आप बोलना चाह रहे थे, मैं उसी वक्त I could not. It's something about bringing out something which is already there and introducing a new point. Okay, wonderful. That's a very good explanation. Dr. Shashikala, what is your understanding of facilitation?
There is some problem with the video. Facilitation is like two-way communication, where you are conveying together. You are bringing out the best possible. That is the facilitation.
Very good. Ramya, I'm sure you're doing a lot of training programs. So what do we mean by facilitation? And why do we need to know facilitation? Unmute your device, Ramya. Oh, you're not connected, Ramya. You're not. Your audio is not connected. I can't see that audio sign on your. No. You know, I was reading about facilitation. Dr. Birendra, you have something more to say?
Yeah, I think I'm trying to go close to the phrase.
Okay.
Yeah, facilitating skills would be something that will ease my listeners to understand what I'm saying. Something like
Very
that.
good. Okay. Very good. Pooja says facilitator helps in achieving the overall objective of the training program. Absolutely right. So I was trying to understand the difference between teaching, training, and facilitation. Again, we are short of time, so I'm going to keep it very specific. Otherwise, I'll go into the, details. And then I came across Socrates' statement that says, "I can't teach anybody anything. I can only make them think." And how true it is. Your audience is adults, educated, professionals. So you can't make them learn anything. Like we say, we can take the horse to the water body, but we can't make that horse drink water. So facilitation is facilitating learning in a very simple way. Facilitation is facilitating learning, creating an environment, creating a condition where learning automatically happens. And if you know the process of facilitation, you can run any program in a wonderful way. When we started working together in session 1, there were some things that I did with all of you. Some of you could recognize it, some of you could not recognize it. But then it motivated you, it created interest, it engaged you. And I can see that change in your approach. Because now you know it's not for her or for the certificate, but it is for my learning. I need to participate and do my session. But then initially I did something that helped you, open up, speak up, and share your thoughts. Dr. Ela, are you tired?
I am tired.
I know. Do you want to have a cup of tea or something? Or all of you, in case if you want 5 minutes break, you can have 5 minutes break. Quickly take something, tea or coffee. Do you want to do that? Dr. Dipti? No? Sure. And if you want exactly 5 minutes break or bio break or whatever, or you want to get up and stretch yourself and sit down. Okay, nobody wants to quit, so let me not force you to take the break. And I found that very, very useful to explain what facilitation is. So let me quickly again start with the slideshow so that we are, in the right direction. Give me 1 second. So whether you're teaching your students in a medical college, or you are doing a training program, or even when you are handling your kids at home and you want to teach them something, direct teaching will not help you. Many of us would fail miserably when it comes to, making somebody learn something, because you cannot teach anyone anything. You can only facilitate their learning by making them think. So that's something that we really need to remember when we are designing a program. And if you want to design a program, a successful program, then you have to learn how to facilitate the program in a manner where they don't feel that I am teaching you because I know more. Where you think we are all discussing and we are learning from this discussion and we are sharing knowledge and I'm an equal partner. So in facilitation, this technique is used by the trainer to help learner discover. Like Monica said, there is always knowledge available. You just bring it up to their awareness. So learners discover, they acquire, they retain and apply knowledge and skills. So ultimate purpose is that they must get more knowledge or clarity. And also if there is some skill involved, they should be able to use that skill. But if you tell them, okay, you need to learn how to wash hands with seven steps, tell this to any consultant. Why the hell should I learn? You think I don't know? But then if you can create an environment where you help them see, I don't know the right way of washing hands. So from first stage of unconscious incompetence, you have to bring them to the second stage of conscious incompetence. So you have to make them aware that you know, but you don't know. The third stage is when you help them learn the right way. So you're not saying that you need to learn it. A lot of time when I do breaking bad news or disclosure of medical errors with consultants, I never tell them that you need to learn it or you don't know. I would say, see, you have residents working under you. You have nurses working under you. So you really need to understand this topic thoroughly so that you can transfer this knowledge to them. I'm very happy. Because now I'm not asking them directly that you need to learn. So you have to create a, arrange your content and delivery in a manner which will foster curiosity, interest, discussion, and reflection. And then facilitator very smartly has a set of knowledge which he or she knows that probably my audience does not know. So without offending, without pointing out to them, they will integrate that information at right opportunity. That's the art of facilitation. And that's one thing that we really need to understand. So to understand how do you go about facilitating, it's very important to understand adult learning. Because ultimately, if I know how do my adults learn and what will work, that will help me in designing my program and facilitating my program in a successful manner. For example, I'm using the acronym of adult. So the first thing that we have to understand is the difference between awareness and consciousness. Can somebody tell me, what do we mean by awareness and how is it different from consciousness?
Doctor,
yeah.
Yes, go ahead.
No, please, sir. You go ahead. Go ahead.
No, go ahead. Yeah.
Okay, Rami,
Okay.
you answer this?
Ma'am, can you hear me now?
I can hear you now. Yes, I can hear you.
Okay. So awareness is a term where you are able, you have knowledge about something, and consciousness is you know where to use it, where you can use that knowledge.
Absolutely, very, very precise, Ramya. So every time you pass a school, you know there is a school. When you see this sign, you immediately know there is a school. How many of us really care to drive carefully to make sure that we don't injure any child or we don't have any accident, where we know kids can be, coming from any side running around? Lot of us know and believe that we need to treat our staff and subordinates with respect. My question to you is, how many of us really practice this genuinely? So awareness is knowledge. So when you will deal with adults, anything you will ask, they will have an answer to it. So never go with the idea that they don't know about it. They know everything. But how many of them are really using that knowledge to their benefit is a question to be asked. So with adults, never think that they don't know. So there is a lot of awareness. They know what is right. But then how many of them are using it? That's a question to be asked. Another thing about adults is that there is always a different learning style. So I could put a question here. How do you prefer to be explained about the directions to a place? For example, you have to go somewhere, meet somebody. It's a new place, maybe new state, new city, or maybe a new place. So what would you prefer? Somebody telling you verbally, you call your friend and you say, I haven't been to your place. I'm coming for the first time and I'm not familiar with that area. Can you give me the direction? So how would you prefer? Tell me verbally, or in between I'll call you. I'll reach till that point and then I'll call you and ask you. Second could be that, okay, you send me, you draw a map and send me. But can you draw in front of me and send me? Or you tell me, I'll keep drawing. You keep telling me and I'll keep drawing. It could be, can someone see the GPS for me and tell me, for example, I have somebody sitting next to me and I'll ask that person to, open the GPS and keep telling me, I can't look at the GPS, I'm driving. So just keep telling me, go straight, move 100 meters, there'll be a red light, move right. Or you like to see the GPS yourself. Answer in the chat box. 1, 2, 3, 4, 5. What do you prefer out of all 5? 5. Okay. It could vary. No, most of the times. 4. Okay. Okay. Mostly 5, 4, 5, 4. Now see, for example, if your option is tell me verbally, that means I'm an auditory listener. I can get an idea if you just read it for me. Just tell me, go straight, move 100 meters, turn right. Or those who have given second one as the option, they are visual learners. They prefer to see it in front of them. So if there is no facility of GPS, they would like to draw. They would like to see the map. They'll carry the map with them because they need to see the map if the facility of GPS is not available. Some people like to draw in their handwriting because they feel if I draw, I will exactly remember, okay, there will be a temple on the right side. And opposite that temple, there will be a bank and they'll write B. And on the right side, they'll write T. Okay, on right side, there is bank. On the left side, there's a temple. Then it's the second red light. So they'll write first red light and put cross. No, don't go here. Then second red light. So that means they want to draw the map on their own. Some people are okay if somebody have the GPS on and they just keep telling, go straight, no, not this red light, second red light. There are people who like to, and those who are okay with, again, somebody seeing the GPS and telling them, they are auditory, they're okay with the auditory. But some cannot do without seeing the map themselves. If it is GPS, they want the phone right in front of them. They will actually have a hanger to put the phone there and they'll always have their GPS. They are again visual learners. My husband, whenever he will visit somebody's clinic, not now, but I'm talking about good 10-15 years ago, he would come back and tell me, अरे उसने बहुत अच्छा क्लिनिक बनाया है, एंटर करो, एंटर करते ही गेट में इतना सुंदर है, राइट साइड पे रिसेप्शन है, रिसेप्शन बहुत ही बढ़िया है, लेफ्ट साइड पे वेटिंग एरिया है, वेटिंग एरिया बहुत ह्यूज है, वेटिंग एरिया के साथ में उन्होंने पानी का अरेंजमेंट करा हुआ है, कॉफी का अरेंजमेंट करा हुआ है, एंड there's a बुक शेल्फ. थोड़ा सा और आगे जाओगे तो राइट साइड में उन्होंने 3 चैम्बर बनाया है, एक वो बैठता है, उसकी वाइफ बैठती है और एक उन्होंने एडिशनल रखा. When he explains me verbally, I literally feel like pulling my hair because I am a visual learner. I feel like seeing it myself. When I designed my house, like renovated my house, I had a huge diary where I had actually made the design myself. Okay, the planter will look like this. The steel design would look like this. Or the kitchen shelf will look like this. Because I like to visually see and then also do it myself. lot of husband and wife have conflict and fight just because they are from different learning styles. And they would actually argue. And I mean, I would always tell my husband, don't explain me. I don't want to know. I just don't want to know what clinic he has been, because I'm not going there. Because that would cause frustration to me. Each one of us has a different learning style. So one way is either understand what is their learning style. The best way is have your activities in a manner where you have all of the or most of the senses engaged. So when you're talking, have something in visual that will engage your audience. When you're showing a visual, make sure that you talk about it, they'll engage. Make them do that, they will get engaged. So similarly, as I said, they have different learning style. Adults would like to integrate those learning styles into their learning. Then the U stands for unlearning slowly. Adults unlearn very slowly. How many of you still use PPT over any other pedagogy, even if it seems like an outdated pedagogy? Write in the chat box. See? How about others? Yes. Yes. Because it's difficult to move from one way of teaching to another way of teaching. Counseling has completely changed. It was more prescriptive and directive to start with. Today, counseling is more like just asking the right question, assuming that the answer is with the client. You just need to ask the right question that would trigger thinking. And if you need to say, it would be just like just 20% of talking, 80% of it is the client's talk. But then we go back to the old style because we are in the habit of prescriptive counseling. I think even in medicine, we are in habit of taking decision on the patient's behalf. We are in habit of directing the patient. We are in habit of snubbing the patient. We are in habit of, threatening the patient. Agar apna diabetes nahi control karoge, पैर काटना पड़ जाएगा. Although we all say that's not the right way of counseling your patient. That's because we unlearn slowly and we need time to learn something. Then adults like to share their experience. So whenever you are, planning a program, always have opportunities where you ask them to share their experience. That will definitely engage them. And then next, they take time to change. It's not easy. Change is not easy. So all of you have a copy and a pen with you. Okay. So write your name with the dominant hand. Done? And now write your name with the non-dominant hand. And if somebody asked you to use only your non-dominant hand, how easy will it be for you to do that?
It's like, learning to write for the first time.
So change takes time.
My handwriting was never so bad. Yeah.
See, I have developed writer's cramp and I have to do a lot of things now with my right hand. And a lot of time I assume that this hand is not there and you have just this hand. Maybe that will give rest to my right hand. I'm not able to do it. So people will take time to change because they have some fixed frame of reference. A lot of things are built into their habits. Unknowingly, unconsciously, they are doing that. They will take a lot of time to change that. So when you're dealing with adults, please remember, adults have these issues. So your program has to be designed and facilitated in a manner where you can keep in mind these things in point. So for example, please remember they need to understand what they learn and why should they learn. So you have to start with address this. Otherwise, they will not sit in your class. They will not attend your class. They will disturb your class. They will also condemn you, criticize you. past night comments because they're not agreeing with you. So very important is to understand that they need to understand why they need to learn. If you're able to address them, they will be happy with you. They will only learn when they're ready to learn. So creating readiness is very important before you deliver your content. Adults learn when their experience and knowledge is acknowledged. So you will have to make sure that their experience and knowledge is integrated in the program. They learn rapidly when the results are satisfying. So initially, introducing small changes will be better because that will bring in positive changes quickly. Then they differ in their learning style, and therefore we need to make sure that our program is facilitated in a manner where all learning styles are integrated. They also differ from one another in their abilities and background. So without pointing out to these differences, you need to make sure that you are able to facilitate their learning. Like for example, even in this group, we have people from different backgrounds. Without creating any bias or pointing out, you need to make sure that you are able to fulfill their need by addressing their abilities and background. Adults learn by doing. When they do it, they learn better. And they develop skills by practicing. So change will not happen immediately. It will take a lot of time. So keeping this in mind, we have to remember that adults should learn the purpose and objective of the program. Make sure that you address it right in the beginning. Engage them to make them participate right from the beginning. Climate should be friendly and informal. So you cannot be a strict teacher or a trainer if you are handling adults, because they would otherwise, can go in the negative direction. Relating their knowledge and experience will make them interested. So we have to bring them in. And one thing that I think for you to be a successful trainer and facilitate the program successfully is that you should be thorough with your subject knowledge. They are looking for an opportunity to derail you or disturb you. So you really need to be thorough with your subject knowledge if you want to have a strong ground. And then creating a need to learn is most important to engage adults. Now, some of the guidelines that will help you in effective facilitation that I'm sharing with you. First is training format. So training format is how do you go about training? One of the ways is sequence. So in sequence, how do you sequence your content? Like for example, simple to complex. So anybody who is getting into surgery as their residency, they need to first learn the simple way of suturing, or even probably at the internship, students learn how do you go about suturing a clean lacerated wound before they learn to operate. So always start from simple to complex. The moment you will introduce something very big, it may become very heavy for them. So even the content has to start from simple to complex. Second, sequencing can be concrete to abstract. For example, if you want your audience to write standard operating procedures, we are writing it SOPs. SOPs are participants are writing. If you ask them to write SOPs, it's going to be very, very difficult for them. But if you take them from simple to complex, from concrete to abstract, and also from known to unknown, you can actually help them learn. For example, normally, how do I make them learn SOP is, I would say, how many of you know how to make a cup of tea? So almost everybody would raise hand and say, yes, I know. So I would say, okay, how do you make your cup of tea? The person will say, okay, I take a pan and add this water and keep on the cooking gas. And then once it starts heating up, I add sugar, then I add tea leaves, and then I add milk, and then I let it boil for 5 minutes and filter. I said, okay, can you write down these steps and the ingredients that you require and how much do you require it? And for how much time you need to boil it. They say, yes, I can do it. Then you say, now, if I ask you to write a SOP for dressing a wound, can you note down these points? Or how do you go about disinfecting a surface? How do you go about sterilizing a instrument? So what I'm doing, something that they're familiar with, they're integrating it with unfamiliar and make them try. Suddenly, if you ask anybody writing SOP, they'll say, no, I can't do. And most of the organizations hire quality personnel because they can't write documents. So even when you are doing a program, if you want to, this is one way you can use where you take them from known to unknown rather than, immediately starting with something unknown and abstract. The second format I would suggest is steps. The first step is tell them. Second is show them. And third is let them do. For helping them learn anything, first you need to tell them what is to be done and how it needs to be done. If you can show them, they'll learn quicker. And then if you ask them to do it themselves, they'll be able to definitely do it. Second thing that I would say that you need to keep in mind is the preparation part. When I say preparation, I would say allow 3:1 ratio for preparation. That means for an hour of delivery, even if you are a seasoned trainer, even if you have delivered that topics almost like 100 times, I would still say 3:1. At least spend three times the time of the delivery. If it's 1 hour session, 3 hours of preparation has to go in. That will give you an opportunity to revise your presentation, to integrate something new, to delete something, to cut down on time, to add on some pedagogy. That's how you can keep your session and program updated. Second thing is, as I've said earlier also, know far more than you will ever use. Never think, oh, I just need to deliver this much. No, you never know where the discussion might go. And if you're not able to hold the discussion, you will lose your confidence and the credibility in the eyes of your audience. Then anticipate all activities will take longer than planned. You may have seen, you may think, okay, this is just 10 minutes activity. But when it comes to actually doing it, it may take 15 minutes or 20 minutes. So always remember that it will take longer than that you are planning. Plan both for smaller and larger than anticipated group. A lot of time you will have planned for a larger group, but you'll have smaller audience, or sometimes it could be the other way around. So be ready for both the same. Then coming to the basic presentation structure. So when you're presenting, I think we discussed this once earlier also, but I'm just quickly going through is opening, but now we are going to, how do you go about doing it? So it could be opening the session, the message that you want to give, then you need to give evidence to what you're saying, and then the closing. So opening can be done in many ways. For example, as I said earlier also, well begun is half done. So opening can be by a startling statement where you say 2/3 of legal suits for medical negligence had communication failure as the root cause of conflict leading to legal suits. Or you could show a slide, I think I showed you in the last this thing, where they were, no, it is in the Breaking Bad. They're carrying a dead body as a procession and a banner in front of it. So that picture can be a very startling kind of a, opening. Or some quotes like from very famous people, single biggest problem in communication is the illusion that it has taken place. Communication actually does not happen a lot of time. So it could be a quote by a very well-known person. Opening could be a picture like this. How many faces can you see in this picture?
Three.
Is it 3?
Yeah.
What do others say?
Dr. Indu, it is one face only. There is no illusion in this.
No,
so,
there's another face also.
I mean, it looks like an optical illusion. I can see that.
Yeah, that's what they think. So actually there are two faces. One is of an old lady and the other one is of a girl, young girl. Yes,
yeah, both.
Yeah, you may call it illusion or what. I mean, but then at least we can see two faces. It's right there. It's right there. The design is made in such a manner. Then this could also be your opening. Another way of opening your program or session could be a compliment. I really appreciate, the way you all attend the session very seriously. Even if you are on the go or in travel, you don't miss the program. So what happens when you actually compliment somebody, the other person aligns with you, feels relaxed, feels comfortable, feels respected. That's another good way of, making an opening. And the compliment doesn't have to be fake. It has to be a genuine compliment. Please remember, a fake compliment can actually do more harm than good. So make sure that you don't go give any fake compliment. Or it could be a dramatic incident where you show them a picture and, talk about that picture and that incident. Or it could be your visit to a place where you share your personal experience. So all these are very good ways of engaging your audience. If you can think of something like this, most likely your audience will become interested in the session or the program. Coming to the presentation part, make sure for any program or any session, let it be not more than 90 minutes. If it's too long a session, people will start losing concentration and interest. Conduct content-rich segment early in the session because they are more attentive, more participative, more keen to learn. Build activities into each segment to keep them engaged and interested. Include visuals and hands-on opportunities, again, to bring variety in the pedagogies. Provide opportunities for repetition and reinforcement, at least the important points that you would like to really talk about. And project enthusiasm, confidence, and encouragement. Please remember, if you do not have confidence in what you're saying, if you are not enthusiastic about what you're talking, and if you're not able to engage them by encouraging them, you will lose your grounds. That's very, very important. Now, talking about ensuring participation. One could be, how do you, by varying the dynamics. For example, you could have a activity which involves the entire group, or it could be a table group. For example, on a table you have 4 or 5 people, so you give them an activity to work together. It could be 3 people in an activity, or it could be pairs, 2 people working in an activity. So change the dynamics so that there's variety in the interaction. The other could be the approach, varying the approach. For example, in varying approach, you could start with, or you could actually deliver your content by asking questions and holding discussion around it. It could be a brainstorming session where you make them critically think about a problem, especially the one for which we do not have ready-made answers. You could also think of, creative thinking options where you make them think, write, and share. So they would individually write their thoughts on a topic. For example, for handing over tools, I usually make them, write down minimum information that they would like to receive if they are going to receive a patient from somebody. So they will write their list of things that they, then I'll make them do this in a group activity between their table mates. And then finally, as a total group, what final 10 things do they choose to, to be the final handing over tool? So you can think of various activities around this. And then of course, role plays, we all know, and videos, they really, really help. Varying activities also can be a good way to, ensure their participation. So quiz, flip chart, reading, demonstration, reports, they're all very engaging ways of your participation. Even the recognition of your participants has to vary. It can't be just one way. You could think of, applauding and appreciating their way. You could thank them for what they're saying or what they're contributing. So these are different ways to, engage your audience. Don't forget to provide evidence to consolidate your message, especially if you're talking something very serious. They would just not trust you unless you're able to consolidate your opinion or your thoughts. So for that, you really need to have form of evidence in the form of, for example, facts and figures, data, research reports that will help them quickly believe you or what you are saying. Exhibits like newspaper cutting, pictures taken on site, another good way of creating or showing them evidence. Some demonstrations which you can you do or you make them do, like role plays, skits, videos. Immediately they will get to see what exactly we want to show them. Illustrations. And then of course, some examples, personal experiences and analogies. All this will help you to create, evidence or provide evidence to your statements or to your opinion. And they're very relevant, they're very important, especially when we are dealing with the adult. See, in a classroom, student will never ask you, prove me what you're saying. I don't believe you. But in this situation, there's a possibility people may not agree with you. If you have evidence, that will help you in, proving your point. So some testimonials, some reviews, all these are different ways of providing evidence to what you're saying. Closing. Coming to the step 4, that is closing. Very important is to summarize. So in closing, maybe you can ask them to share their takeaway. What do you think you learned from it? Or it could be a statement that you make where you tell them, like for example, in nutshell, communication skills are not just about patient satisfaction, but they add to the professional satisfaction of the provider as well. So that could be a closing statement. Or ask the participant to share their takeaway, or maybe ask them to repeat the important message, or throw a challenge. Try doing it. I'm sure you will be able to see the result. Or something like, if learning new ways is boring, try ignorance. So again, you are kind of letting them know that you can't take trainings lightly. Things to ensure when you are, facilitating a program. A very important thing is physical setup and sitting arrangement. Please try to avoid auditorium sitting or a classroom sitting, because there, when people are not, facing each other and they are sitting together, they are more likely to get disengaged. The last batch, the last, benches, they are likely to, play mischievous or get disengaged or lose concentration. So it's always advisable to make your students sit around the table. So in Maulana Azhar Medical College, I've been doing programs for all these years, and we have a T-shaped table there. So some of the students will sit on the side of the legs, and the last batch would sit on the T side of the T arrangement. Students sitting on the last side would usually, would play something or talk something which you cannot hear. So there is a possibility of getting disengaged. So this year I made them sit around a table. So we had 8 tables, and we separated that, setup of T, and we had those tables lining, 2 at a time and 4 rows. It really worked well. It was easy for me to really engage them. So physical setup and sitting arrangement are very important. Have arrangement for whiteboard and writing pen. Projector, I think we all need to make sure that you are able to showcase whatever you want to show them. Name tags, a very important thing. I really find it very useful. Have at least even this time in MAMC I did this. They have a name tag, but they will normally wear it in with a thread, and it will be down the near their navel region, which you cannot read. So this time I said, please write their name in capitals large enough so that I can see the name even from almost like 10 feet. And that name tag has to be put here. The moment you call them by name, it settles them. They are more engaged with you. They know you are looking at them. They know you can read their name. So they are less likely to get distracted. Wall clock for yourself so that you can keep an eye on the time. Like I can see I'm left with just 5-7 minutes. So I have an idea that I have to complete it as early as possible. Same way you can cut down the content, elaborate the content depending upon the time available, if you know what time it is. Facilities like water or cup of tea, again, if your setup permits, I think that's a good idea. So other resources like, if you want to do an activity on flip charts, stickies, handouts, you will have to ensure that they are already there. So before you begin your session, it's very important to establish the group ground rules. For example, please speak for yourself, maintain the decorum, don't disturb others. In case if you have a phone, if you need to really attend it, please go out and attend. So all those ground rules you can actually, announce in the beginning so that everybody knows what they're expected to follow. And then before you begin your session, if you can orient them to what we are going to do, in how much time we are going to do it, and what is the purpose of the program, that will again help them know where they are heading. When the audience speak or anybody speaks in the audience, make sure that you listen with attention, because if you don't pay attention and you don't respond, they feel ignored. That's not a good way of engaging the adult audience. So praise and attention, actually it has a profound impact on anybody's entire life, because they will remember your words. That's what we people say. People don't remember what you said. People remember how you made them feel. So if you make them feel special and important and knowledgeable, they remember that. When you are responding, please make sure that you acknowledge their answer. So their answer may not be the exactly what you're looking for, but they have tried answering your question. So I think they need to be actually genuinely appreciated for making an effort. So appreciate by recognizing the attempt. Then even if you don't agree with the answer, there's a possibility that the answer they're giving is not correct. But instead of disagreeing, no, this is not the answer I was looking for, that's going to put off the person. Rather than ask others to add the points, you will see others will fill in the gaps and you will have a complete answer. So never negate anybody's answer, even if you disagree. And then in case if the disagreement is very clear, widely visible, smartly handle the disagreement by adding correct information, but appreciating the attempt to reply. Then ensure everyone's participation. Usually what happens, some people will be very active, especially the front benchers, you will see they're very active. The last benchers would not take much interest, but you have to make sure that everyone is participating. Keep an eye on the direction of the group. A lot of time you will see the group is going in another direction. They're disengaged and they are not interested. They are even thinking of what is this and why are we learning all this. So you have to really keep an eye on it and watch their non-verbals. That will give you a lot of idea about how things are going in your group. There can be conflicts, so you need to be prepared to handle these conflicts in a very, very sensible manner. We'll talk about it in a while. Then there can be subgroups in between. You will see smaller groups will form and they'll be talking and discussing. You really need to handle it very carefully. I mean, in spite of practicing so many times, again at times what you do can go haywire and go against the desired result. I've recently had an experience where there were two people who were really, really disturbing. So I made them sit separate because I was getting really disturbed. I said, can I request both of you to sit separately? They did sit, but then they felt annoyed. They were upset. They were really, they felt insulted. They went and spoke something about the program to the organizers. So you can well imagine what could have happened. So you really need to be careful. How much do you really want to, say or do, or what will be the right manner? So pick your battles carefully. Too small distraction, too small, disengagement, you got to handle very carefully without, offending them. We'll talk about it. I've shown this earlier also, and I'm showing it once again. Content has limited value. Experience has long-lasting impact. So make sure that you create multiple experiential learning opportunities by engaging them in different ways. Some of the attributes that I would say that will, if you are able to, acquire and work on and excel at that, that will really help you in making your program interesting and facilitating it successfully. I think enthusiasm and commitment has to be there. If you don't seem committed, or if you're not enthusiastic, you are unlikely to get your future assignment. So for example, as I said, I did initially 500 programs for a government sector to start with, how I came into healthcare communication. And the program was organized by Health Secretariat. I had to go to the hospital. Somebody from the hospital was training coordinator who would call the audience and make them sit in the auditorium or whatever lecture room they had. I mean, I did this for 2 long years. I think the only reason why I kept getting the assignment was because they could see the commitment in my work. And if they can see the commitment, they'll align with you. So you really need to, be enthusiastic about what you're doing, be very sure of what you're doing, and that commitment should be visible. When you're starting your session, chances are everybody will not align with you. There'll be a lot of ambiguity. You will be able to see right from their faces that they are judging you, or they're reading you, or they're not agreeing with you. So you really need to have patience for everybody to understand your point of view. So tolerance to ambiguity is very important. If you get disturbed with little changes or little confusion, for example, in feedback, if 10 people have given feedback, if 8 to 9 people are okay with you, 1 or 2 people do not agree with you in spite of your best effort, you will have to understand that all 100 people cannot be with you. So you really need to have this tolerance to ambiguity, or yeah. Then interpersonal sensitivity and relations are very important. You need to be conscious of it. You need to really be very mindful when you are handling your audience, because anywhere if you will miss this, it can again backfire. Cultural awareness, in some cultures something is considered okay, in some cultures something is not considered okay. So you got to remember that I can't offend somebody's cultural differences and call them good or bad, and facilitate a program. Uh, if you are a full-time trainer, naturally you'll be visiting different organizations, meeting different people. So being open to meeting new people, having new experiences is very important. Otherwise, trainings can be very exhausting and very, painful. Cognitive and behavioral flexibility is another very important attribute that you need to have. A lot of time you will go prepared with a big content, but you are given less time. But if you say, no, I cannot do, I have to get that much of time, only then I will deliver. Or you have prepared your session for, say, larger audience, or some activities you prepared for a different audience, and the audience is different. And you say, no, I can't do it because I don't know. Then again, you are going to have trouble. So you need to be really cognitively and behaviorally flexible. Empathy, I think we have talked a lot about it. Similarly, audience comes from different background. People are tired, they had a long day, they may not have had their food, or maybe their day was not good, maybe there's somebody unwell in their family, it could be a financial problem, it could be anything. So we can't just take things personally and call people that you are not attentive, you are not interested, why are you here. Rather look at things from their point of view, and then probably you will be able to bring them to this on the same page. Again, honesty is very important. You may not know everything. It's practically impossible to know everything. I was reading this book by Atul Gawande, that is Checklist Manifesto. And he said 13,000 diagnoses, 4,000 surgical and medical procedures. So for anybody to know everything on the tips is practically impossible. Why not admit, I really do not know, but I can find out for you and get back to you. So even as a facilitator, don't think that you know everything and you should know everything. Yes, you should know much more than you need to deliver, but then there can be a question which probably you never thought. Be honest rather than giving a wrong answer or a false answer. You can say, honestly, I do not know, but I can get back to you in the next session. Sense of humility plays a very big role in engaging people with you. Anytime you show arrogance or ego, or I know all, I am the trainer, you are here as a student, I am the leader, all this is not going to work for you. Rather, it will go against you. Please remember, they are all learned people, experienced, knowledgeable, they have a lot to share. And if you say, I'm also here to learn from all of you, automatically it levels the ground. They'll become more open and happy to work with you. So your question, Dr. Birinder, sense of humor. Sense of humor is very, very important, but you really have to be very careful when you're using humor as a way to handle a situation. Because in a lot of situations, humor can go higher. But if you are good at it, if you know how to use it, it really can help you handle a very difficult situation. And I'll be talking about in a while about how do you go about handling using humor to handle disruptive audience. I'll be talking about it. But humor plays.
Thank you.
But it plays a very big role, because sometimes even making fun of yourself helps you to kind of showcase to your audience that you are like one of them, and you're not trying to show that I am more knowledgeable than you. But yes, it has to be used very, very carefully. Then personal awareness. A lot of us become angry, annoyed, upset, disturbed with little, changes in the program or plan or audience. Again, if that's what is happening with you, you really need to work on yourself and make sure that you have good control on, regulating your emotions and your thought processes. A very important thing, and that's disruptive behavior that we want to talk about. So we have exactly 10 minutes left. If I put a quiz for 2-3 minutes, is that okay? Because we are left with just a few more slides. So give me a second. It's an interesting quiz. Okay, it's an interesting quiz, and that will give you an idea about, how, what kind of audience we can get and what is the right way of. Where is it? Should be here. There it is. Yeah. So can you see the, is it visible? Now, these are common disruptive behaviors you will come across in your audience. So let's see if you know how to go about handling it. So for example, a lot of time you'll have people arriving late for the program. What would you think? What do you think would work? Remind them of ground rules, use humor to make point, or bar from session?
I think I will appreciate to.
Dr. Birinder, on your side, there is some network issue or something. There's a kind of humming sound coming from the background. What do you think it could be? Is it fan?
I think allow them and but yeah, remind them that these are the ground rules.
Or maybe use the humor to make a point.
Exactly. So maybe both of them will work. Especially, see, for example, if you're doing a program for a senior consultants, and if you remind them of ground rules, do you think that will go well with them? Dr. Dipti, how can you be late for the session?
I was late today.
So imagine if I had asked the same thing in a rude tone. Don't you know that we are all supposed to join at this time? I'm sure next time you'll not come.
Even that won't go well with a senior person.
Again, if you have good rapport with the person. But generally, if it's somebody senior to you or, in the senior hierarchy, it will not go well. Even telling them about the ground rule will not help you. So maybe you will have to take that with a pinch of salt and maybe use that as a humor. Oh, I thought you're coming for the next class. You're too early for the next class.
Or rather, we should thank them for joining this.
Thank them for joining.
Ma'am, how about
how about?
Yeah, I was saying, I guess that.
Is there any more noise from my end?
डॉक्टर वीरेंद्र, आपकी आवाज बिल्कुल नहीं आ रही है. वो है हमिंग साउंड है पर आवाज नहीं आ रही आपकी.
मैडम आवाज आ रही है?
अब आ रही है, थोड़ी बेटर है पहले से. हाँ जी.
पता नहीं क्या हुआ. So once they complete the very senior.
एक बार लॉग आउट करके लॉग इन कर लो. We will wait for you to join back. Yeah.
Okay, fine, sure.
Meanwhile, what I was saying is, ma'am, if we use humor to make a point, and I don't know, this is my belief that if it's a senior person and we use a humor to make a point, I believe they'll be more offended. Instead, if we could tone down and say, like this, for example, sir, I believe you're late for the class, but I would request you to please make it on time next time. We're still communicating that it's a ground rule to make it, But
You will publicly, no. Humor, I'm not asking you to use with the senior faculty. No. I'm just saying this is for generally. For
okay.
example, if it's a student, for example, I'm doing a program for the medical student. So I can remind them of ground rule that, see, you are supposed to be here on time. A lot of time in MAMC, this has happened. Student would join 2 hours after the beginning of the program. I will straight away say, I'm sorry, I can't take you in. You have missed almost 1/3 of the session. So you will have to join the next batch. But this is where I can assert. I can't assert with the senior faculty that why are you late? With Dr. Dipti, I played this game because we are comfortable with each other, and she knew that I'm just, kind of showcasing something to others. But with seniors, we can't even use humor. No, humor will not work. And even saying that, please remember, I know you are late and we can, maybe either you will have to just ignore it with the senior faculty. Or if you need to say, maybe you'll say, sir, I understand you must be really busy, but if you come late, then others also, it sets a precedence for others. So it becomes difficult for me to, then tell all others to be on time. So I really do not know how we can help it, but if you can help me with this. So you're throwing the ball in their court. But you cannot use humor also, especially with people with whom you do not have any initial rapport. There you cannot, it will be too big a this thing to play. Yeah, Dr. Shashikala, you were saying something.
It may be just eye signaling or just stopping over for a minute and then making a way, ma'am. Maybe it's more of a body language than any language used.
But again, the risk is you may lose that audience.
No, body language in a positive way, like maybe like you'll say, okay, it may be aggressive, please sit, or something like that. You are allowing them to come, but you're not at lost time. May not be a words or anything. You will not stop the flow. You'll just you will observe them with your body language.
Yeah, giving them little time to settle down so that they become conscious of the fact that everybody is now looking at me. I have come late and the session has been disrupted because of me coming late. Yeah, Pooja, you want to say something? Go ahead, please.
Yeah, ma'am. Ma'am, basically, selecting the appropriate option down, like depends upon the kind of audience which is there, and of course, like if this behavior, suppose for the late arrival, and we are doing number of sessions over there, if this continues, one person repeats it multiple times, then there is the reaction could be a bit different. That, as you told us, that if multiple times the people are coming late, then you can say that that you cannot attend that also. So, but
with seniors, you can't
again,
do this. That's why I'm giving
with the seniors,
with students, you can say. With like, for example, with younger audience, you can use this strategy, but you cannot use this with people higher.
With the seniors, not
absolutely. Completely, yeah. So second is talker. I'm sure sometimes you'll see people who do a lot of talking. They'll disturb your session. They'll ask a lot of questions. And how will you handle them? Ignore them, call on others, or have them take your place?
I'll give them a topic to prepare.
No, right in the meeting, right in the session. There's a session going on, and this person is doing a lot of talking. So you'll ignore it, you'll call on others, or have them take your place.
So what is it, call on others? Like, I didn't understand this call on others.
Call on others is when you will actually call others by name and prompt them to answer.
Okay. Yeah.
You will ask them, okay, Pooja, can you explain in your words? Dr. Ila, can you explain in your words? What do you understand? So what I'm doing, I'm calling the name and redirecting the question to the other person so that this person knows that question is not for me, but for this person. Of course, ignoring will not help because then it can disturb you. And of course, you can't have them take your place. Okay, there will be people who are one-track mind. Like they will just, they'll just take one point and they'll continue talking about that. So how would you handle them? Like if somebody says patients today are very demanding and you have so many, of course, that could be one of the concerns, but there could be 10 more concerns. But they will take one point and they'll stick to that point. How will you handle them? You will interrupt them, remind of ground rules, and then I'm sorry, which one it is? Oh, sorry, one track mind is fourth one. I missed the third one. We'll go back to that. So for that answer is give demerits, use peer pressure, and prompt group for other ideas. C. Yeah. So
From the
it's
group.
yeah. So it's better to throw the question to the larger audience so that others also start, giving their ideas, and this person will get to know that my point may be right, but then there are other options also. There are other. Number 3 is long-winded. So you will find people who would have a very long answer to even a small question, which could be yes or no. So they'll start sharing their knowledge and they'll start talking about what they know. So what do? Interrupt, remind of ground rules, counter with one long stories. Own
I
long
think
stories.
remind with ground rules, I think.
I think politely interrupt. Politely interrupt saying the way we actually
maybe C also to a certain extent, no? Adding to what they are saying and then cutting it short.
Whole them will engage and everyone will sleep.
So Dr. Shashikala, how do you handle such cases where people have long answers to give?
We have to interrupt here, reminding a little bit with the time, and there is no other way, ma'am. We have to interrupt.
So the best way will be wait for them to stop for a breath.
I think, ma'am, is the same way we discussed in the dealing with patients who give us with unnecessary history for a long time in rush OPDs. Probably tell them, explain to them that we have a limited
But we
time.
can't do this to the audience. With patients, maybe you can remind them. With this, I can't say, okay, Pooja, you are giving very long answers. I can't allow you to speak for so long. There's others also who need to speak. Will Pooja be there with me for the rest of the session? Because I have insulted her. So I can't say, Dr. Ila, you are not answering. You need to answer. You need to participate. She'll feel pointed. But if somebody is giving a long answer, in between the moment they stop to take a breath, you say, yes, I understand what you're saying and I agree with you. Let us ask others, what do they say? And move move to the others. Okay. People who are non-participating. So what do? That's number 5. Use brainstorming, single out, make an example of them.
Probably make an example of
use
them.
brainstorming.
Use brainstorming.
Dr. Gaurang, I think you were saying make an example of them.
Yeah, because I feel when you use brainstorming, they might be in an unexpected position. Like they might not expect that, and again, it is going to end up in a situation where they feel embarrassed. So, of the given 3 options, single out will actually make them feel pointed, which is again derogatory. So, making an example of them and pulling them along in the discussion will be a better option of the 3.
So can you give me a demo of how do you make example of them? For example, if I'm not participating, so what will you do to make me participate by making an example of me? Because making an example is again pointing out to them. That will not help. So use brainstorming and then encourage that person to give more ideas. You know this person is not. So ask some questions to them. Make them, Balureka, I have not involved you today. I know you are outside and I have not even called your name once consciously because I know maybe you are not in that position to answer. But then I'm trying to engage everyone by calling their name. So I am not pointing out that you are not participating, but I'm throwing the question to them. So when you use brainstorming, okay, each one of you give me an idea of how do you go about handling it. Each one of you. So that person will automatically feel like giving you some answer. Suppose that person is still not opening up. What do you say, Dr. Gaurang? What is your idea about it? I'm sure you also must have seen something like this in hospital. How do you handle that situation? So what you're doing, you're making that person speak. But we don't have to single out or make an example of them. If you make an example of them, then again, they may feel isolated or pointed out. Okay, a lot of time you will see sidebar conversations. People will talk to their person next sitting to them. Again, how do you handle them? Stop group discussion to listen, stand next to the talker or reprimand. कैसे करोगे? Which is better?
B और C तो B और C
B is
दोनों
better.
लग रहे कर सकते हैं. We can do both B and C. C can be done in a very different way.
C मैंने
Reprimand may
करा था
not
ना.
be.
C मैंने करा था तो मेरा ही प्रोग्राम वाइंड अप हो गया.
C मैडम जरूरी नहीं है कि बहुत स्ट्रेट फॉरवर्ड होके करेंगे.
रिप्रीमेंट में तो आपने कर दिया, सबके सामने उनको खड़ा कर दिया. You pointed out. आप ऐसे कैसे बात कर सकते हैं? तो सी तो नहीं है. स्कूल में चल सकता है सी, स्कूल में चल सकता है, एडल्ट लर्निंग में नहीं चल सकता. राम्या क्या कहती हो? Will you use C?
No, madam, I won't use C.
Which one?
But I don't. You have to. A could help us stop the group discussion to listen. So you can give some example or ask some questions to the group so that they could answer and they stop talking with each other. Something you have to divert their mind towards yourself. That's what you could do, I think.
You know, a lot of time, if they are talking between themselves, just keep quiet and look at them. And when they become conscious of the fact that you are looking at them, you can say it's okay, you can complete it. If it's a younger generation, no, man, no, it's okay. They will come back. They'll align with you. With seniors, you can't do this. Or maybe if it's a full day session, maybe during tea or lunch break, you can politely talk to them one-on-one and say, see, I know at times, you get a lot of ideas when we are doing an activity. But if you talk in between you, I get distracted. I don't have notes and, content ready with, in the form of a, format. So I lose the flow of the content. So I request you to not to disrupt the session. They'll become aware, but you have not pointed out to them. Dr. Shashikala, how do you manage such cases?
I think we have to stand next to them only. I feel
sometimes even that helps. When you go closer to them, put a hand on their shoulder. Again, it's all about
smile.
I do it even with the medical students sometimes. I just put a hand on their shoulder and say, and they'll become aware, okay, I have been identified as a, talker or maybe disturbing everybody. You'll also see people multitasking. So what do? Remove the offending item, take away their phone, remind them of ground rules, or turn over to group.
Turn over to group is better.
It's one of the good ways. Again, if it is too much of disturbance,
you can stop it. You can request them to.
Probably there you have to say, okay, sir, if the phone call is very urgent, you can go out and attend. But
so what's turn over to group, ma'am?
That means you rather than focusing on that person, you move to the larger audience and you start interacting with them and ignore that. Ignore that because, if you get into altercation or argument, it can end up into, another level of argument. So probably you will have to carefully, ignore. But then again, one-on-one, maybe you can talk to them during tea or coffee break if it's a full day session. With youngsters, maybe you can politely tell them, see, I know a lot of time, we have things to do, but then for the time being, if you can put things on hold and pay full attention to what we are discussing, that will be good. But you will have to really choose depending upon the situation. Then what about people who pass snide remarks? You use sarcasm, ask them to elaborate, seek group reaction.
I will ask them to elaborate on that.
Okay. What about others?
I think, okay, others, right?
Yeah. So you are, I think you're on mute mode, Dr. Gaurav. Unmute yourself. Yeah.
Sorry, ma'am. I was saying seek group reaction.
That's another good way. I think again, both the things can help depending upon the situation and the audience kind. So for example, sometimes when they make a remark, baseless remark, they will usually not have any substantial, material to say. People are useless. And if you ask them, or doctors are useless, or the hospitals are useless, for example, and then you said doctors are useless or the hospital, can you tell me more about it? On what basis have you made this?
But it will lead to more a chance for them to talk. And
No.
I think that
What I'm saying, when they make a baseless remark and they are giving a more generalized, they will not have anything substantial to say. And once they have given their answer and you say, okay, let's ask others, what do they think about it? So you have thrown the question to the audience. So usually half of them will not say anything, but some of them will say, no, I don't think that's true. There can be random cases of this kind, but that's not true. So automatically their remark will get neutralized. Then people who use cell phone, next one.
Remind them of ground rules.
Okay, that's one thing.
I don't know, maybe I
remind them. B.
Because I can't hold the training.
Sometimes even temporarily halting the training also helps. I would do it a lot of time. When I see somebody is constantly, and if you just wait and make them aware that because of you are talking on phone, we are waiting for you to finish. That's kind of a reminder that using phone in the meeting is not a good idea. Or you can, request, can you please go out and attend? Again, at some places you can say, at some places you can't say something like this, please go out and attend. With seniors, probably you will not be able to say something like this. Dark cloud. What do? Get their input, shift issue back to management, or cut them out. What do we mean by dark clouds? Pooja, what do you say? What do we mean by dark clouds?
I was about to ask you this itself. I mean, the people that was on my face itself.
Disinterested, ma'am?
Anybody?
Disinterested people?
No. That we already taken as non-participating, no?
Maybe the interruptive elements, like the people who are somehow making some chances to create some nuisance over there. Some people are there.
So they are more
negative people. Some negative people, I mean, who are in general trying to
hijack the training.
So a lot of times. Sorry, go ahead, please.
Yeah, they are trying to pull you down or unnecessarily putting a spanner in the whole program to derail it. Something like that, I would say.
So they are just there to derail your session, to hijack your session. A lot of time when you will go to a government setup, or even why government, even in the, ma'am, you are asking us to talk nicely to the patients. They have not even paid us 6 months salary. How do you expect us to be nice to people? And then you start discussing with them, know this, know that, and you realize you have lost the time and you are nowhere.
I guess all three situations will work here. Most of the times people who are purposefully waiting, purposefully doing something to derail the program, I guess if getting their input itself, when they're given that presence or when they're given that opinion that, yeah, okay, their opinions are being given important, I think they stop that for some section of people. So it works at times. But for issues like you just quoted, ma'am, regarding the salary or something, I guess we will have to shift the issue to the management. That's something as an external person or a trainer, we cannot do anything. And obviously ignorance is bliss. So you can always choose to ignore. These all three options would sit.
Absolutely. So you have to very carefully kind of tell them that this is not the issue. This is beyond the scope of the program. What you're talking is beyond the scope of the program and not something that we can address it here. So I would request you to talk to the management and resolve between you rather than talking about it. So you will find people who are confrontational. They are not just passing slight remarks, but they may even say that what you are saying is wrong, or I don't agree with you, it's not making sense. So how do you handle them? Consider removing them from session, be persuasive, and report them.
Be persuasive.
Being persuasive will help over.
Empathy. Show empathy.
So of course, other two will not work. If you consider removing them from session or report about them, it's not helpful. But yes, definitely being persuasive and then throwing their statement to the group and seeking others' opinion will neutralize what they are saying. That would help. And then physical threat. If somebody physically threats you or your other team member, so how will you suspend training? Absolutely. I think your safety is most important. So suspend the training. So I thought I must give you this quiz to help you see how much ever ready you are. Sometimes you will have a very difficult audience, and they are the one who would actually, take a real test of your training skills. So you really need to be thorough with the idea. How do you go about handling them? So initially, I mean, I would, get into talking to them, explaining them, but if I can identify that they are not in mood to agree with you for a while, even if you ignore them, but not in the manner that you're insulting them. Give them little time to settle down and then engage with all others. And slowly these people would ultimately fall in the line. They'll align with you and they'll agree with you. But for that, you need to have patience and you need to really know how do you go about it. So if we categorize the disruptive behavior in 3 degrees, that is low degree, where they are either daydreaming, negative body language, not participating, and cell phone user. So they are not actually directly interfering with your delivery. They are not disturbing your program. Only thing is they are not participating. So in all those cases, one is you can try to engage them by asking relevant questions or making them participate, but then you can't be after them and you cannot, point out in a manner that they become uncomfortable in the group. Of course, the moderate degree is where people becomes, aggressive and they indicate distrust and disagreement. They pass snide comments or they may talk something which could be, insulting, or they may actually be, attending to something else. They may be doing a sidebar conversation or they may be passing a sarcastic comment. So these are all moderate degrees. Again, you can't ignore them. They need to be attended, but then you have to be careful not to get into any confrontational mode with them. You have to politely but firmly point out the the behavior that's not appropriate for the larger group. If we talk about the high degree, where it is actually display of aggressive behavior, dramatic exit from the training venue, or they may threat you or others, or they may pass disparaging remarks towards other. You need to really take this into account. You can't allow this, and you have to insist on maintaining the decorum of the program so that you can run the show. Going about how do you handle all of them, I think acknowledge the behavior. Don't ignore completely, because if you're ignoring, then that means that the president gets set and they would keep repeating. Determine the underlying cause. It could be they are sitting at a wrong place, or they are not able to see the projector, they are not able to participate. You may address it by making them sit at a place where they can actually see and interact with you. So, like for example, I said assign them seats, but then again it should not be done in a controlling manner or aggressive manner. Establish ground rules politely, and changing your interactions with them, reading their verbal and non-verbal. All this will give you an idea like with whom are you dealing and how you want to deal it. Then having a private discussion with them during tea, coffee break will be a good idea, where you can tell them what is expected from them or what is not appropriate, but never do it publicly in the presence of others, because it can get into a argumentative kind of a situation. So resolved by positive behavior, as I said, if you stay positive, if you stay confident, if you engage positively, if when they participate and you encourage them, acknowledge their participation or contribution, usually they stop, control their behavior. Usually you will see them falling in line. So in case if things are going out of control, then it's very important to take appropriate action by, maybe in case if you even have to report to the management about what happened, or if they're misbehaving with any of their colleagues, even that is something you can't take it lightly, that needs to be shared with the management. So this is in nutshell about the facilitation skill. Any questions about what we have discussed? Although I know we have been discussing and asking questions in between, and we are way beyond our time, 20 minutes. I can see half of you are sleepy and tired. I knew that it's very difficult to club both the topics and cover in one session. Any questions? Yes, please. Yes, Dr.
Ma'am, I just have a point to make.
Yes.
I felt when I, read about the facility, I mean, I was hearing you on the facilitation and everything. Some of the traits of a trainer is very similar to a performer on the stage. And I was just equating to like holding the audience. There are no second cuts. You can't take breaks, and you have to engage. There has to be the right mix of humor, meaning, all of that. So is that true, right? I mean,
absolutely,
there's a lot of performance skills there.
Absolutely.
Yeah.
So even people like Amitabh Bachchan and Salman Khan, they have learned acting, they have learned their language skills, they have learned delivery of their dialogues. Only then they are able to do it impactfully. So similarly, as a trainer, as a facilitator, if you are not thorough with your work, if you haven't practiced your content and delivery, you won't be able to hold your audience attention. It's very important to be thorough with your preparation.
And as a single person, mostly the trainers are, one trainer usually.
Yeah.
To hold an entire audience, and sometimes on multiple days together. Something, that's what I wanted to say.
Absolutely. It's very challenging. It's very challenging.
One question that I have is, should we read a lot about human psychology? Will we need to read on psychology?
It will help you. Knowing about human psychology will help you align your audience with you. It will help you creating personal awareness. You will get to know about your weaknesses or strengths. And then it will give you an opportunity to work on yourself. People who become anxious, or they have performance anxiety, or they have stage phobia, or they have thought blocks. I mean, we have seen people having these kind of things. So if you are aware of these things, all that can be learned and overcome.
Okay, thank you, Dr. Indu.
Thank you. Yes, Dr. Dipti.
I understand reading psychology would be helpful. I think that would be helpful in any field of life with any interaction.
Absolutely.
Sure.
Yes. What to read, how much to read. That is like it's a gut instinct that psychology. मुझे लगता है कि जिंदगी की शुरुआत में साइकोलॉजी बदलनी चाहिए इंसान की, आधे कंफ्यूज खत्म हो जाएंगे लाइफ के.
Absolutely.
To be honest, but then what to read and how to read, that is required.
Yeah. So again, like for example, if you want to understand basic psychology, then you have to look for basic books, theories of psychology, theories of leadership, theories of learning, if you want to learn that. But I think even if you become a keen observer of human behavior and understand your behavior and behavior of others, you get to learn how do you really go about using this to your advantage.
No, I think Dr. Deepti pointed out the right thing. So I think behavioral psychology, that part where we, how we deal with people, and how to understand, what they are. That is something probably we'll have to also side by side, take some interest.
Oh yes. As I said, that a lot of questions will be related to human behavior.
Otherwise, it is a full-fledged branch, and then it
No,
doesn't end.
So,
absolutely.
It doesn't end.
so for an ignorant person like me, you will need to share material on behavioral psychology or some useful which will at least help me.
Yeah. So, like for example, letting your audience take time to align with you. If you understand this, how do you really align them proactively? How do you build rapport with them? How do you win their trust? If you know about it, you would be proactively doing it right from the beginning, because your program will only run successfully when you have your audience on the same page and you are all working together. So you have to create that sync. So understanding this part will definitely help you. Definitely help you. Yeah. Yes, Dr. Monica, I think you want to say something.
Yeah, ma'am, actually, I have a question. So, like, since we are talking about human psychology, so what I have seen and with my experience also, that Indians function with generally two psychologies. One is psychology that is fear of missing out, FOMO, and second is interest. So, being on the trainee side right now, like we are trainees, so if we don't have that much interest or commitment, so as a trainer, what should be our limit? Like हमारी responsibility कितनी होनी चाहिए, कितनी commitment होनी चाहिए कि पूरा audience को आप एक commitment के साथ जाते हो समझाने के लिए, but like the factors you talked about कि कोई interested नहीं है या कुछ participation नहीं है, तो कितना हमारा commitment होना चाहिए as a audience and as a trainer also?
देखो 100% आपको सबका attention 100% time opportunity मिल जाए, that is very unlikely. That's a very ideal kind of a situation. But if majority of the people are with you, that means you're on the right track. Only thing is you now need to excel at it. I mean, there's a scope to improve. There's a scope to improve. So you can work on your training skills. What more can I do to make sure that I can engage, more people for a longer time? So practically expecting everybody to be with me on the same page throughout the program is something very, very ideal. That's not going to happen. But in case if I see 60-70% of them disinterested and not participating, then I really need to work intensively on my content and delivery. So there is no one line answer in terms of percentage, but then you get a gut feeling, oh, this session was a failure. Ask why. What all did I do that it failed? Or what all did I not do that led to failing? You'll start getting answers to it. So whether you are when you are a trainee, so you have gone with the purpose. If you know clearly what purpose you have, and if that purpose is not fulfilled, why did I not fulfill? What did I lack? What did the trainer lack? Have a talk with your trainer so that you can communicate what you need or what you want. So it's a.
Ma'am, would it be a good idea? Sorry, would it be a good idea to ask in the beginning of the session that how many of you are here because of interest, out of interest, and how many of you are like fear of missing out? Like
No,
it is important for your.
We all know in India, training as such, especially on topics like this, there are very few people who are keen to learn. Very, very few people who are keen to learn, even if they know that it is important, even if they know they don't know it enough, but they don't consider it as important as their clinical skills because they think it's something that can be learned and done. So that wouldn't be, especially if you will ask them, then they say we are not interested. So rather, that's going to rather upset you. For example, all of them say, no, we are not interested. We are here because the management has asked you. I think your energy to conduct the program will go crashing. Don't ask risky questions.
Generally, ma'am, this used to happen with us when we started. Like, so they were the trainees sitting with dull faces and not interested generally. So that's why I asked this question.
But then, right from the
Thank you, ma'am.
beginning, engage them in a manner. With these medical students, a lot of time I do this to start with. Okay, how many of you like window shopping? Kids, I mean, they immediately become excited. Yes, we like. Okay, one of you come here. Let's start the window shopping right here. Do the window shopping and then let them do it. Then make them aware. See, this is your mindset to be sitting here. Then how do you expect your program to be successful? Then they suddenly become silly. So every time you need to have some new way of creating interest. Yes, Dr. Yeah, Pooja, you want to say something? Go ahead. Yeah.
Yeah, ma'am, actually not saying. It's like, no, when we in the training, whenever we are there, ultimately everything boils down to now the human psychology, because no, all these things we discuss, ultimately when even the audience, no, when we talk about them, when we try to understand the audience, ultimately it boils down to the psychology. So my thing was like just to have an idea about to start with. If you have interest in psychology, to start with like something which gives a basic information, so that you can start building onto that, because I'm a beginner, like I have just starting this thing right now. So practically something which is which can help me out to understand this aspect.
So for example, there's a book by Dale Carnegie on public speaking. It's a beautiful book that will help you understand. And Dale Carnegie uses all principles of rapport building and creating good relation with people and making them feel good and align them with you. So that's a very good book, and that will give you very beautiful tips to go about programming your way of delivery in a manner that people align with you. Then there's another book by Dale Carnegie, How to Influence People and Make Friends. So it's like making friends. You want your audience to be friends with you.
Right.
It's not like pleasing them. It's because if they are with you, then your speed of work will be very different. Absolutely. Your experiential learning will be very different. If everybody is with you, then your task becomes very easy. So I think reading these practical books will help you more than reading the basic psychology books. That would be just more like a syllabus for class 11, 12, and but reading these books will give you direct, peek through into the human brain and how do you use it to your advantage. So very quickly, let me give you the link for the feedback form so that you can give your feedback and we close the session. I know we are very, very late. But then if I put it in the WhatsApp, it can be.
Ma'am, I had just had a question.
Yeah.
So I guess from the next session, we're going to have the pedagogy presentation.
Yeah.
So once we are done preparing our presentation slides, which is like for 15 minutes max, can we we can connect with you, we can drop you a mail, and then we can run through you, right, before we present it in front of others?
Of course. Each one of us will have to prepare maybe initially the draft, discuss with me, or the final presentation, because we are not looking for very detailed presentation, just I say 10, 12 slides, not more than that. Even less than that will do. And once you have done your preparation, just discuss with me what you're going to do and how you're going to do. And in case if I have something to add on, I'll share with you, and then you make the presentation on the day. And I think session 5 is Dr. Shashikala, and who is the one? Who's the other one? Anyone, please tell me if you know. Otherwise, let me see. I have the list here with me.
But we have said the topic or which topic we use this pedagogy.
Yeah. For example, somebody has chosen the topic as storytelling as a pedagogy. So what you have to do is give us a small demo by telling us a story, an interesting story that can engage us. And then you ask just 2-3 questions around the story. How did you like it? How did you find it? What thought process did it trigger in you? And that's all. So it could be a storytelling about leadership, but we are not going to talk about leadership. We are going to now talk about storytelling as a pedagogy. So then you have to show 4-5 slides like what is storytelling? How does storytelling help in the program? Advantages and disadvantages of storytelling, do's and don'ts of storytelling, and where all can be applied.
So as you said, leadership, that is the context of this pedagogy.
Yeah. So you can say, once you finish the storytelling, you will say, okay, this storytelling was for leadership. If I want to teach servant leadership or situational leadership or any leadership style, you can even
that
ask,
can be anything. That's
maybe you ask, okay, what message do you get from this story? So somebody might say, oh, this is about leadership, or it could be about taking responsibility, or it's anything. So yes, this is how we can use storytelling for various purposes in our programs. So session 5 is Pooja, it's you and Dr. Shashikala. Dr. Shashikala, are you there?
I'm there.
Okay. So both of you will have to make the presentation, and before that you need to connect with me. So maybe in a day or so, today is Saturday. So by Monday you can prepare your draft and just connect with me over phone. We can speak once. First share the draft. Let me have a look at the draft, and then we speak over phone, and you tell me what exactly you intend to do. And in case if I need to suggest some changes, you make the changes. And in case I need to see the presentation once again, I can see. You can mail me the final presentation, and then you can make demo on the.
Ma'am, I'm going today out of station a little bit. So Tuesday, can I send it? Tuesday or Wednesday?
It's okay.
Tomorrow morning I'm traveling. Yeah.
No problem. Take your time. You have to be ready with the final version of your presentation before Saturday. So keep it Friday, because even if you send me on Saturday, when it will be beginning of day for you, it will be beginning of night for me. So I will not be able to read it. So at least by Friday, you should send it to me.
Yeah. Can I do it next week? Because 22nd is a wedding, 19, 20, 21st. So I'm traveling for that.
So maybe you can check with anybody who is ready to change with you in the group. You can post it in the group. And if anybody, Monica is not there today. Sorry, Monica is there. Namrata is not there from the previous for the next session.
Next session.
So if Monica is ready to do it next week, I'm okay.
I chose the topic first, but I didn't know the name will come first. I just chose.
Ma'am, for me, next Saturday and next to next Saturday would be a bit, because I have a very early morning flight on Sunday morning. So Saturday would be very much haphazard because it's late night over here. No, so that's the only reason. Otherwise, no, because next and next to next.
You can put
two
in
other
the
things
group.
because next Saturday is I'm returning back.
So both of you can put in the group and request somebody to exchange with you.
Certainly.
You're okay. I don't mind. I have absolutely no problem. And I didn't choose anybody's name. I just put it in random that, okay, these people are already in training. I mean, the idea why I put your name first is because you are already in training and doing training. So seeing you, they will learn faster. That was the plan I had. Nothing this thing. But if others are ready to change with you, I'm okay with the idea. I think Dr. Dipti, you have not added your name yet. Everybody else has added.
Actually, I haven't really gone through the list seriously. It's been a very, very hectic day, number one. So, and practically, I was trying to decipher out whatever the topic of the list, because I tell you, for me, this is a new language. Whatever you're writing is new language to me. So for me to understand in my context is taking the time. Number one. So I guess I'm not too sure. I mean, I do understand. I don't know how much I do fully I understand. So maybe I'll go through it.
See, why I kept your name and Dr. Birendra's name and Dr. Gaurav's name last is because I thought you will see others doing and then you will know how do I go about it.
Yeah.
Ritika, if you are comfortable, you can take prior to others, and then topic is not a problem. Dr. Dipti, we can discuss and I can help you with these topics or any other topic, which I think will be helpful as a pedagogy for everyone to learn. And as
I think 30th will be a Saturday. I don't know whether this is the right forum, but I would be occupied that evening.
Okay.
So what we do about it, either we prepone it or do it some other.
I think Dr. Ela also had some concern. That was for which Saturday? This Saturday?
30th.
So again, we can ask everyone, if Saturday doesn't suit, then we can keep it on Friday.
Yeah.
So you can ask in the group. Anyone of you can put.
Yeah, we will discuss it on the group.
Yeah, we can post it in the group.
We can check our calendars and work it out.
So I hope all of you have given your feedback. Yeah,
Got
I've
it.
received only 4 feedbacks. So I'll put in the group if you want. You want me to add to the group?
Can I leave, Dr. Indu?
Yes, please. Those who have done, you
But
can leave.
I think
And
PG has to call me for the rounds and everything is waiting.
oh my goodness. Go ahead, please.
Okay.
Please go ahead. Yeah.
Good night, ma'am. Good night.
Thank you, everyone. Yeah. Thank you. God bless you.